Good morning. This hearing will come to order. Welcome to the Committee on the Budget's hearing examining the ballooning cost associated with waste, fraud, and abuse in our nation's entitlement programs and the implications to taxpayers, the strength and sustainability of these programs, and the overall fiscal health of our country. Today, we will hear from a panel of expert witnesses in the area of government waste, fraud, and abuse. And I'd like to briefly welcome all of them. Thank you for your time and your insights. Dr. Brian Blase, president of the Paragon Health Institute. Dr. Blase previously served as special assistant to the president for economic policy at the White House's National Economic Council from 2017 to 2019. Mr. Nick Stehle, right? That's how we say it, Stehle. Mr. Stehle is vice president of communications at the Foundation for Government Accountability. Mr. Stehle is also a visiting fellow at Opportunity Solutions Project. And then our former colleague here on the Budget Committee, Mr. Matthew Dickerson. Matt's Director of Budget Policy at the Economic Policy Innovation Center, or EPIC. Mr. Dickerson previously served, obviously, here on the Budget Committee as Senior Policy Advisor. Did a great job. Welcome back, Mr. Dickerson. The Honorable Robert Gordon, Doris Duke Distinguished Fellow at Georgetown University's McCourt School of Public Policy. Mr. Gordon previously served as Deputy Assistant to the President for Economic Mobility at the White House's Domestic Policy Council. And we welcome you, Mr. Gordon, as well. Thank you for your time today, guys. I'm going to jump into my opening statement. I'm going to try to get it done in 5 minutes. It's a little long. The first order of business in addressing the unsustainable spending here in Washington and the looming debt crisis that hangs heavy over our country is the unchecked growth of waste, fraud, and abuse in our nation's entitlement program. This should be a nonpartisan, bipartisan issue. Like, we need to rein in spending. We ought to all agree with this category of wasteful spending. It's money taken from taxpayers and spent in ways that not only violate the laws, but common sense, while also undermining the promises made to the most vulnerable Americans. In Washington, promises to tackle waste, fraud, and abuse have become like New Year's resolutions. I thought you'd like this part. I mean, we all make promises to address it. We include them in all of our budgets, but we rarely, if ever, execute on them. So we proclaim them loudly, but quietly abandon them. And that's both parties. Both parties are guilty of that. And the cost of this inaction, though, is quite staggering. One major driver of this problem is what the Government Accountability Office categorizes as improper payments that were wrongly made or were made in the wrong amount. Last year alone, the GAO identified $31 billion in Medicaid improper payments. $31 billion is nearly the state budget of Arkansas, Delaware, Idaho, Vermont, New Hampshire, and South Dakota combined. And those are partial audits. The last full audits were significantly higher. The only two last full audits, I think it was 19 and 20, were significantly higher, almost 30 cents on the dollar improperly paid. And Medicaid improper payments are often the result of costly combination of lax oversight and blatant fraud, unverified documents, false income claims, and missing household information that never gets flagged, let alone fixed. In the Supplemental Nutrition Program, or SNAP, which provides food assistance to nearly 42 million people, GAO identified $10.5 billion in improper payments for an error rate of 11.7%. I think that's doubled over the last few years. In SNAP, state governments frequently fail to check for basic eligibility criteria, whether it's citizenship, employment, finances, or even someone's identity. When the system fails to prevent fraud because of lack of accountability or the right incentives, the fraudsters gladly seize on that vulnerability. In Baltimore, a dozen store owners stole $16 million by trafficking SNAP benefits through fake retail transactions. Another example, in New York, a government worker used SNAP benefits to buy energy drinks and resell them to corner stores, pocketing almost $2 million. In Florida, a couple used nearly 700 stolen identities to obtain SNAP cards and then swap them for cash at a corrupt retailer. And the list goes on and on. These are not isolated incidents. They are symptoms of a system with inadequate guardrails and vulnerabilities that invite fraudsters to siphon funds away from those that the program was intended to serve. Through the One Big Beautiful Bill Act, this committee, the full House, and hopefully soon the Senate, have advanced reforms to restore accountability and ensure our entitlements actually serve the people they were intended to. Vulnerable Americans, not fraudsters, not schemers, and not people in this country illegally. By ensuring illegal immigrants, and importantly, the bill addresses some of the fiscal mismanagement that I just mentioned. One, ensuring illegal immigrants don't benefit from taxpayer-funded social services so that the safety nets are there into the future for our most vulnerable American citizens. Two, preserving and strengthening Medicaid by enhancing enrollment verification and ensuring only those who are legally eligible receive the benefits. Three, reining in state financing gimmicks like provider tax schemes meant to siphon away federal Medicaid dollars, which actually will drive up premiums and crowd out Medicare patients as we're paying to reimburse Medicaid patients at commercial rates. And as I mentioned to Brian and some of the panelists earlier, even in our One Big Beautiful Bill, we could do more, and I hope and encourage the Senate to do more in that regard. And capping, by the way, President Biden, President Obama called these things scams. This is a bipartisan opportunity to go big for the taxpayer and the folks that are counting on these programs. Just as important, the House One Passed Big Beautiful Bill restores the dignity of work itself. A moral imperative for humanity, I think we would all agree, but also essential for prosperity in this country. Able-bodied adults without dependents will be required to work or volunteer, pursue education, or train for at least 80 hours per month, with, of course, common sense exemptions. These are programs and policies that President Biden supported and Bill Clinton himself signed. That equates to less than a part-time job and reflects a basic belief that public assistance should serve as a bridge to self-sufficiency and not as a long-term substitute for work. The House passed reforms to SNAP will close all the loopholes that have allowed states, including California, Illinois, Nevada, and Washington, D.C., to completely waive their work requirements. In California, there is no able-bodied person who is on SNAP who's required to work among these other states. So we need to end the accounting gimmicks, close the loopholes, encourage work and self-sufficiency, and ensure benefits go to those Americans who truly need them. This will generate nearly $300 billion in savings, by the way, without taking a single penny from eligible Americans. On our current trajectory, our debt will reach $150 trillion by 2025 by any measure. This is unsustainable. I think both sides would agree. Interest payments on the debt crowd out other federal spending, making it impossible to respond to the challenges that future generations of Americans will face. The One Big Beautiful Bill takes a meaningful first step to right-size our bloated bureaucracy by reining in reckless spending and rooting out this waste and fraud and the abuse that's driving our nation deeper into debt. That's why it's crucial that my Senate colleagues only consider changes that will go further to advance fiscal reforms. Today, we're fortunate to be joined by three distinguished experts. I just introduced them. Thank you again for being here. This is an important discussion because it's central to reversing the curse. As James Madison said, a public debt is a public curse and the worst of its kind. And with that, I yield 5 minutes or as much time as my colleague, the ranking member, may need.
Thank you, Mr. Chairman, and I do thank the witnesses and welcome back, Matthew. But thank you all for taking the time to be here today. So obviously there was a lot just said. Let me attempt to address some of it. Here is the state of play. According to the Nonpartisan Congressional Budget Office, the Republican bill, the big, beautiful bill for billionaires, will throw 16 million Americans off their health care. That is a fact. It will also deny nutrition assistance to another 4.5 million Americans. Why? In furtherance of more than $5 trillion worth of tax cuts, almost all of which go to the top 1% of Americans. In fact, this tax cut will end up being an increase for the bottom third of Americans when you look at the bill in its totality. And that's quite different from the Reagan tax cuts of '81 or the George W. Bush tax cuts of 2001 or 2003, or even the original TCJA from 8 years ago. The Joint Committee on Taxation found that if this Republican big bill were to become law, every household making under $55,000 a year would be poorer as a result of this legislation. So the facts remain, under this legislation, the poor will get poorer, the rich will get richer, and the middle class will be falling further behind. But that's not all. The bill also dramatically increases both our deficit and our national debt. On a dynamic basis, the bill increases deficits by $3.4 trillion. So for all the talk that we're hearing about deficit and debt, this bill takes a bad situation and makes it far worse. Now, as we spent a lot of time together in the middle of the night on the House floor some weeks ago, I noticed that you tended to hear a couple responses from my Republican friends to these facts. One was to simply just deny the Congressional Budget Office's analysis altogether. Here's the problem. It's not just the official scorekeepers, CBO. It's a Joint Committee on Taxation. It is left-leaning groups. It is right-leaning groups. It is nonpartisan groups, all finding the same thing. This dramatically increases deficit and debt and will lead to millions of Americans losing their health care. Their second argument is, okay, maybe millions will lose their health care, but they're all illegals anyway, so it doesn't matter. Not true. Again, the CBO has verified these are almost all entirely people here legally or U.S. citizens. And then that brings us to the last point, which apparently is the subject of our hearing today. Well, it's all really just waste and fraud. Now look, I want to be clear. When it comes to rooting out waste and fraud, this absolutely should be bipartisan. As someone who believes that government can be a force for good in people's lives, I'm offended by the idea of anyone who would rip off the system. Some of the examples that the chairman just referenced were egregious. Those people, frankly, broke the law and should be prosecuted fully. So there is no defense on this side of the aisle for any actual instances of waste and fraud and, frankly, criminality. But the real fraud here is to pretend that 16 million Americans who are going to lose their health care are all just defrauding the system. That doesn't pass the smell test. No rational person recognizes that millions and millions of Americans are going to lose their health care, but they're all somehow fraudsters. What an actually insulting perception one must have of the American people. Studies continue to show the hardest working people on earth, the most efficient workforce, the American people. The fact of the matter is, most folks in my district work damn hard just to get by. I represent a great district, half the city of Philadelphia. People in my neighborhood and the neighborhoods I represent work hard, play by the rules, and are just trying to advance and provide more for their kids than they have. That's actually the face of the American family. Hard-working folks. So this bill is egregious. It will be, and this is a fact, the greatest loss of health care in American history. It will add trillions of dollars to the deficit and debt, making our challenging problem even worse. And in the end, who will benefit? The wealthiest 1% of Americans. It is wrong, it is bad economics, and I hope that anyone watching this who is as outraged about this bill as I am will get active and get involved. It was just a one-vote margin in the House of Representatives a couple weeks ago. It might just be a one-vote margin in the Senate, just like it was 8 years ago when saving the Affordable Care Act came down to one vote, and it ended up being a thumbs down. Because of that thumbs down, more than 20 million Americans have their health care today who otherwise wouldn't have it. I hope history this summer can repeat itself. With that, I yield back.
I thank my ranking member, and in the interest of time, if any other member has an opening statement, I ask that you submit it for the record. We'll hold the record open to the end of the day to accommodate those members who may not have prepared a written statement. Once again, I want to welcome our witnesses. The committee has received your written statements, and they'll be made part of the formal hearing record. You'll have 5 minutes each to deliver your oral remarks. Dr. Blase, get us started.
Thank you, Chairman Arrington, Ranking Member Boyle, members of the committee. My name is Brian Blase, and I am the president of Paragon Health Institute. Our nation's future depends on reforming federal health programs. Over the past 4 years, Biden administration policies placed our nation on an unsustainable fiscal path. In Medicaid and Obamacare, the Biden administration prioritized enrollment at any cost, diverting resources from the most vulnerable, enabling fraud, and shifting significant Medicaid costs from states to Washington. Today, the federal government covers 75% of Medicaid spending, far above the historic 60% share. Incentives matter. Biden-era incentives led to massive federal spending with little health benefit. CBO projects $1.9 trillion more spending on Medicaid and Obamacare over the next decade than it forecast at the start of the Biden administration. I will address 3 major problems. First, massive improper enrollment. Paragon research shows 6.4 million people enrolled in fully subsidized Obamacare plans who do not qualify. As a pandemic measure, President Biden signed legislation that expanded subsidies, making coverage fully subsidized for people with income between 100 and 150% of the poverty line. The Biden administration curtailed eligibility verification and disregarded mounting evidence of improper enrollment. Large fraud rings emerged that misled applicants with free perks, coached income misstatements, and profited from commissions, while insurers reaped windfall profits. A recent Bloomberg News expose quotes agents saying half of enrollees had no idea they were signing up. One broker said, quote, "You have to throw away a little bit of your morality," end quote. Improper exchange enrollment will cost the government nearly $30 billion this year. Automatic re-enrollment perpetuates improper enrollment. Nearly half of current exchange enrollees took no action during open enrollment and were simply auto-re-enrolled. Fraud led to plans being switched and canceled without enrollees' knowledge. Millions have other coverage or don't know they're enrolled. On Medicaid, the Biden administration extended the COVID public health emergency, leaving nearly 20 million ineligible people on Medicaid. The administration then made it harder for states to remove ineligible recipients. Second, program incentives divert resources from the most vulnerable. On average, states receive 7 times more federal funding per state dollar spent on able-bodied expansion adults than children, pregnant women, the disabled, and seniors. Expansion states have strong incentives to classify enrollees under the expansion and focus resources on able-bodied adults. Bad incentives have led improper federal Medicaid payments to total $1.1 trillion over the last decade. Third, states are increasingly using legalized Medicaid money laundering tactics to pay commercial rates and shift costs to the federal government. Medicaid money laundering, where states tax hospitals, recycle funds back, and claim federal reimbursement, exploded during the Biden administration. The Biden administration issued a rule that states could make Medicaid payments through insurers up to average commercial rates. Commercial hospital rates are nearly triple Medicare rates, so Medicaid now often pays much more than Medicare. This threatens seniors' access and leads providers to prioritize Medicaid over Medicare. These inflated Medicaid payments quadrupled under the Biden administration. The One Big Beautiful Bill introduces needed reforms. It reverses the Biden administration's enroll at any cost approach. It reinstates eligibility checks. It appropriates funding for Obamacare's cost-sharing reduction program, which will lower premiums. It prioritizes Medicaid as a social safety net with a community engagement requirement to promote work, education, and volunteering. It empowers individuals by expanding HSAs and ICRAs, giving Americans, not bureaucracies, control. It limits Medicaid money laundering by freezing the provider taxes that states use to inflate federal payments. The past 4 presidents have identified Medicaid provider taxes as scams. It caps new state-directed payments at or just above Medicare rates. It ends schemes like California's Medicaid tax scam that brought in $10 billion before the state expanded Medicaid to unauthorized immigrants. Even with these reforms, Medicaid and Obamacare will still cost $500 billion more over the next decade than CBO projected at the start of the Biden administration. But they are critical steps to preserve the programs for those who need them and protect taxpayer dollars.
Dr. Blase, thank you. Mr. Stehle, 5 minutes.
Chairman Arrington, Ranking Member Boyle, and members of the committee, thank you for hosting this important hearing. I am Nick Stehle, the Vice President of Communications at the Foundation for Government Accountability. But today, I'm here more as a dad. My family and I have experienced the shortfalls of the Medicaid program as it currently exists on a deeply personal level. Now more than ever, the Medicaid program desperately needs reform to promote work over welfare, protect the truly needy, and root out waste, fraud, and abuse. Medicaid's ballooning enrollment has left the most vulnerable behind. Across the nation, more than 700,000 individuals, most of whom have intellectual or developmental disabilities, are stuck on Medicaid waiting lists for needed home and community-based services. The average wait time for these services can last nearly 16 years in some states. As you might imagine, many don't have that long to wait. Remember, every dollar that goes to an able-bodied adult on Medicaid who can and should be working is a dollar that doesn't go to the people the program was intended to help. These aren't just numbers on a sheet of paper. These are real people, including kids with intellectual or developmental disabilities. Real people like my son Luke, who is here for today's hearing. Luke has severe autism and epilepsy. Though he probably had his first seizures in the womb, the first seizure we saw was at just 7 weeks. I held my tiny newborn son as he seized. It took my wife Leanne and me taking him to multiple hospitals before someone finally believed us. 16 years later, we finally learned why. A rare gene mutation linked to profound intellectual disability and intractable epilepsy. Luke is a sweet and happy young man. He enjoys video games, Star Wars, hunting for diamonds with his grandparents at Crater of Diamonds State Park in Arkansas, and fiercely loves his siblings, Peter, Joel, and Isabel, who are also here with us today. A couple of years ago, we sought out help through the Home and Community-Based Services waiver so that he can get the critical Medicaid services he needs to help him be a part of the community and so that he can receive in-home care when my wife and I can't be there. At the time, we were told that the average wait for someone like him was 11 years. He becomes an adult in a little over 200 days. At this point, we don't know when he'll ever move off that list. It's easy to talk about Medicaid reform. It's another thing entirely to live it. I see firsthand how able-bodied adults, 62% of whom do not work, are siphoning away resources that can and should go to fund services for our most vulnerable. These groups move to the front of the line while kids like Luke wait years for the services they urgently need. It's not easy to talk about these things in front of the whole world. It's painful. And the truth of the matter is that our family is going to be okay. Luke has 2 parents who adore him. He has 3 siblings who love him as well. And he has grandparents, all 4, who live nearby and are there to help at the drop of a hat. So why am I here? Because my family story is not unique. It's the story of people in our community and thousands of others across the country who don't have the voice or the resources, financial, family, or otherwise. Imagine being a single mom to a son with autism and epilepsy. You're working hard, trying to keep a roof over your head, and you're told, as we were, that help is coming in 11 years. Meanwhile, your state is spending hundreds of millions of dollars on able-bodied adults who move to the front of the line, ahead of your child. This kind of help may be the only thing keeping your child from being institutionalized. But waiver services are out of reach, while those who could be working don't have to lift a finger. Does that sound right to anyone in this room? Medicaid reform is not a choice. It is a moral imperative. Choosing not to act puts the truly needy last and fraudsters and able-bodied adults first, all while taxpayers foot the bill for an ever-growing program that no longer meets its mission. Now is the time to set Medicaid on a sustainable track, and one that protects the individuals it was intended to serve rather than sending them to the back of the line. I'm grateful for this committee's work on the critically needed reforms in the One Big Beautiful Bill. I'm grateful for Chairman Arrington's commitment to refocus the program on the truly needy. And there is much work to be done, and the truly needy cannot afford to wait. Thank you.
Thank you, Mr. Stehle. Mr. Dickerson, you have 5 minutes.
Chairman Arrington, Ranking Member Boyle, and all the members of the committee, thank you so much for inviting me to testify today. It's always great to be back here with you all at the Budget Committee. Medicaid and food stamps are the two largest means-tested programs, and they're both in need of reform. My remarks today are going to focus on shortcomings in the food stamp program. In recent decades, enrollment has expanded significantly, benefit levels have grown faster than inflation, and taxpayer spending has surged. The program's work requirements are weak, limited, and often waived. Because of this, few of the millions of work-capable adults on the food stamp rolls work at all. More than 42 million Americans receive food stamps today, 3 million more than did so in 2020 during the pandemic. Since the year 2000, enrollment has grown 245%. Some enrollees do not even meet the statutory income and asset requirements. Meanwhile, spending on the food stamp program has exploded. The program is expected to cost $110 billion this year. In the last 25 years, annual spending has grown 645%. President Biden's policies increased food stamp spending by 54%, meaning the baseline for food stamps is now $394 billion higher over the next decade than originally projected. USDA admits the food stamp program makes billions of improper payments each year. The reported improper payment rate in 2023 was 11.7%. But we know that improper payments are actually much higher. The 2014 Farm Bill literally instructs USDA to ignore improper payments up to a quality control tolerance threshold. This year, improper payments below $57 per transaction are simply not reported. That's completely egregious and would get any small business in jail, owner in trouble for ignoring waste, fraud, and abuse. Because states are administering a program that is completely funded by the federal government, they have little incentive to control overpayments. As a result, many states have shockingly large overpayment rates. Introducing a state matching requirement whereby state governments would bear a portion of the program costs would certainly help this problem by giving states skin in the game. The One Big Beautiful Bill's cost-sharing requirement that's based on improper payment rates would not reduce or change total benefit spending on food stamps, but it would promote better outcomes for beneficiaries, it would promote fairness and fiscal federalism. The One Big Beautiful Bill would also make significant progress in promoting opportunity over dependency by restricting loopholes and enforcing work requirements. While 13 million able-bodied adults received benefits in 2022, fewer than 3.6 million able-bodied adults without dependents were supposed to be subject to work requirements. But many of these work-capable individuals could receive welfare benefits without working due to geographic waivers and no good cause exemptions. Because of the loopholes, 84% of those who were supposed to be subject to the work requirement did not work the 20 hours per week. There is an inherent dignity in honest work. Work is not a punishment, but instead it provides an important source of purpose for people. It's demeaning to believe that many Americans are simply unable to be successful and should be relegated to a life of dependency on perpetual government subsidization of their basic needs. Instead, we should enact policies that empower people to earn success based on the belief that poverty and dependency can be temporary conditions. The best welfare benefit is one that gets a person off of welfare and back into work. The reforms included in the One Big Beautiful Bill represent important progress in addressing waste, fraud, and abuse, and eliminating these loopholes would restore food stamp program integrity while safeguarding assistance for the truly needy. So thank you very much, Mr. Chairman. I yield back.
Thank you, Mr. Dickerson. Mr. Gordon, you have 5 minutes.
Thank you for the opportunity to testify. I led Michigan's implementation of work requirements until they were enjoined in 2020. Work is central to economic security, civic standing, and the sense of self-worth. Yet H.R. 1's Medicaid and SNAP provisions will force working people into a bureaucratic maze that prevents them from working and hurts their health. Rather than fight waste, this law creates waste. Consider the following. According to the Census Bureau, most Medicaid recipients are working, often in tough jobs like construction, home health. Some each year will be among the 20 million Americans who lose their jobs. The vast majority want nothing more than to find work again. But under this bill's community engagement requirements, it is not enough to look for work, even 40 hours a week. Unemployed individuals need to be in school, in community service, or in a government-sanctioned work program, a type of program that has shriveled in recent decades and even more since January. If they can't be in one of those programs, they can be cut off their health insurance. If ever there was a case of wasteful government overreach that undermines individual initiative and work, this is it. Here's another example. When Arkansas's law took effect, Adrian McGonigal was working at a poultry plant and managing his COPD. He told the state about his job, but only once, not every month as the law required. He lost his insurance, then he couldn't afford his medicine, then he got sick, then he lost his job, and a few years later, in his 40s, he died. Multiple studies find that the ACA's expansion of healthcare saved American lives. Taking away healthcare from 16 million Americans, 16 million people, will cost American lives. Now you may say, these are growing pains. But if you don't expect miracles from the state normally, don't expect them here. This bill cuts resources for states while piling new demands on them. Take it from me, I did this, linking data systems, overhauling workflows, rewriting forms, standing up call centers, hiring auditors, managing appeals, more and more, less money to do it, and just 18 months. Baked into this law's DNA is a future of failure. The proposal is premised on myth upon myth. I'll touch on just 3. The first is that millions of able-bodied Medicaid recipients are doing nothing. Using data from 2 premier census studies, surveys so central that even this administration has not disturbed them. More than 90% of Medicaid recipients are working, engaged in caregiving, sick or disabled, or in school. In other words, more than 90% are engaged in activities that qualify them for exemptions under this bill. The second myth is that there is an error rate in Medicaid as high as 25%. PolitiFact labeled a less aggressive claim as mostly false. I would be glad to get into the reasons why the claim is based on faulty data and faulty assumptions. Finally, I want to say it is a myth to believe that we have to choose between caring for Mr. Stehle's beautiful family and child and caring for other people's families and children. The states that have expanded Medicaid spend more on children and on children with disabilities. They have shorter waiting lists for home and community-based services. To create a healthcare Hunger Games in this country will be a choice. It is not a necessity. To be fair, there is one group that will benefit under this bill, and that is government contractors. For timely employment data, states will use the work number from Equifax, which sometimes costs $20 per person per query. $20 may not sound like much, but with 18 million people subject to reporting as often as once a month, this is a revenue opportunity with 8 zeros, maybe 9. Georgia paid more than $60 million to the leading system integrator for a glitchy system and an ad campaign that netted fewer than 7,500 enrollees out of an estimated 240,000 people who might have qualified for benefits. So that's a contractor payoff of $8,000 per enrollee. No wonder Jennifer Palka calls work requirements welfare for Deloitte. While incumbent vendors thrive under this bill, CBO reports it will cut resources for the lowest income Americans by an average of $1,600 a year, about 4%. I realize you may not believe me today. Perhaps you will believe it when you hear from your constituents about this bill in a year or two. I appreciate the opportunity to testify.
Thank you, Mr. Gordon. We're going to move to the Q&A portion of the program, and I'm going to yield 5 minutes to myself and then to the ranking member. My constituents, who you suggest I'll hear from, are unfortunately getting misleading information about the bill. In particular, people who would be, quote, kicked off of Medicaid. There's been misleading statements and fear-mongering galore about the safety net, quote, being ripped out from under our most vulnerable, disabled veterans, sick, pregnant mothers, et cetera. I think personally, and I'm not directing this just at you, but as the Democrat witness, I'm telling you, it's a gross mischaracterization. That's polite language. And I think it's preying on vulnerable people to say that. So what I did was because the statements have been around CBO, the independent, nonpartisan Congressional Budget Office's analysis or statement of the 7.8 million people who would be without Medicaid as a result of the passage of the One Big Beautiful Bill as it was passed out of the House. But I needed more information, so I sent a letter along with Chairman Guthrie. Who are those 7.8 million people being, quote, kicked off of Medicaid? Well, I've got the letter here. This is the same nonpartisan, independent CBO that was referenced by my Democrat colleagues. And they state very clearly that the 7.8 million people are people who are able to work who refuse to work, legally ineligible, but we don't do or haven't done the sort of program integrity implementation and enforcement like verifying people's eligibility, or they qualify for some other government subsidized health insurance, or 1.5 almost million people are here illegally and should not benefit from taxpayer-funded social services. We're having a tough time with $36 trillion in debt, $2 trillion in annual deficits, $1 trillion in interest, and a future insolvent Social Security trust fund along with Medicare and the list of disastrous concerns into the future on fiscal sustainability of these programs continues. But that's it. They literally say, CBO estimates that enacting Medicaid provisions in Title IV of the H.R. 1, the Big Beautiful Bill Act, will increase the number of people without health insurance by 7.8 million by 2034. Of that number, 4.8 million are people who are able to work who refuse to work. Of that 7.8, 1.5 million almost are here illegally. 1.6 million are ineligible or are eligible for another government subsidized health insurance and refuse to get it. So we need to set the record straight. I've taken enough time. Anyone can read this for themselves. We sent the letter requesting this information June 18th. We just got it yesterday, June 24th. I encourage everybody not to submit it for the record without objection. So ordered. Brian, you talk about the healthy relationship between the state and feds for good fiscal management of programs. That doesn't exist anymore. In fact, it's worse than we thought with respect to Medicaid. And the state's bilking money in cahoots with providers and other groups, locally, insurance companies. Talk about that and how out of control it's gotten and why it's so important that the Senate goes even further to lock out these schemes that are hurting the vulnerable people's safety net into the future and also wasting tax dollars.
Yeah, I mean, thank you for that question, Mr. Chairman. Underpinning Medicaid has been a shared responsibility between the federal government and states, where states historically paid about 40% of the cost, which meant they had skin in the game. They had agency to care about the value of the spending. There's been two real problems that have distorted that relationship. The first is the economics of Obamacare. States are getting $9 in federal funding for every dollar that they spend on the expansion population, which is on average 7 times more in federal funds that they get for a dollar of spending on traditional enrollees. And the second is the growth of this very abusive money laundering system. The way it works is that the hospital, I'm going to use hospitals as the example, but hospitals will lobby to be taxed. So you know it's not an actual tax. And so the hospitals will send, say, $1 million to the state. The state sends that $1 million right back to the hospital. That's an accounting gimmick, but the state then invoices the federal government. And the federal government on average is spending, 70% reimbursement. So they're able to get $700,000 of federal funds for what is an accounting gimmick. Under the Biden administration, that accounting gimmick exploded, and the payoff to these very powerful hospital systems are rates that are magnitudes above Medicare. So we have a huge amount of corporate welfare interjected in this program because that's what the federal government has incentivized states to do.
Thank you. And Biden and Obama called it a scam. They were right, and we ought to address it. And I yield 5 minutes to my colleague, Mr. Boyle.
Thank you. I don't know what this world is coming to because now you're quoting Presidents Biden, Obama, and I keep quoting Josh Hawley. So when Senator Hawley said that these Medicaid cuts are morally wrong, I have probably quoted that more times than I can think of. Let me quote another Republican senator, actually, while we're on it. This is the former Senate Republican leader. Quote, "I know a lot of us are hearing from the people back home about Medicaid, but they'll get over it." That's the attitude from the Republican leader emeritus in the Senate. Get over it. I don't think the tens of millions of Americans who are going to be impacted by this bill are going to merely get over it. Now, I want to address something just very quickly because I think there might be some confusion. CBO estimates that of the 16 million people that will lose coverage, about 15 million are American citizens or people who are in the country lawfully. Undocumented immigrants are not eligible to enroll in federally funded coverage, including Medicaid, CHIP, or Medicare, or to purchase coverage through the ACA marketplaces. So I do want to clear up that confusion that is out there. Now there's a lot of conversation today about work. I've said it before and I'll say it again. I believe in work. I believe in work, not just about the dollars and cents, but a way of life. When I was growing up, my father was a warehouse worker, would never turn down overtime. So rarely did he only do 40 hours a week. Except overtime, you get time and a half. So it'd be 8-hour shift and then either another 4 8-hours after that. And on a 100-degree day like today, working in that warehouse was not exactly as comfortable as things are in this room. Then on the weekends, he had his own side business, landscaping, and still had time to take my brother and me out to play baseball. I learned more from that, not through lectures, but by the eloquence of his example. That is good. That, frankly, looks like a lot of the families and a lot of the parents I know in my neighborhood in Northeast Philly. So the challenge is when we go from an abstract argument about work to the real reality of paperwork requirements, there's the rub, right? And so, Mr. Gordon, I'd like you to address what the practical implications of those paperwork requirements were in Michigan, and did, in fact, people who were working full-time end up losing their coverage that they were qualified for because of these onerous paperwork requirements?
Thank you, Representative Boyle. Yes, it's hard to overstate how challenging it is to implement a system like this. I came in as the director of Michigan's Health Department. This became our #1 priority. We wanted to work on helping reduce mortality for pregnant women or helping address fentanyl deaths. This was #1. And it required an all-hands-on-deck approach, $30 million in spending to put requirements into place. Lots of hiring. If you don't like bureaucracy, you really shouldn't like work requirements because you got to build to make them even passably work. And even after all of that in Michigan, we were on track. Now, the program was enjoined, fortunately, but we were on track to see more than 100,000 people lose their health care. It's more than the population of Flint, Michigan. And we know from all of the research that is done on this, the Arkansas experience, national samples, that most of the people on Medicaid are working or they are in other categories that under your legislation
More than 90%.
are exempt, over 90%. So if I may, I did see the CBO letter last night. I'm quite sure that CBO did not say that 4.8 million people were able to work but refusing to work. There were 4.8 million people, many of them would be working and would lose coverage for exactly the reasons that the gentleman in Arkansas lost his coverage and lost his life. And many others would be caring for people with disabilities. They would be on disability themselves, adjudicated. They would be going to school, trying to better themselves, maybe working on the side a little bit, but not enough to meet the work requirement. So that is what we're actually talking about here, is a bill that comes down extremely hard on people who are doing everything they can, trying to play by the book, advance themselves, just as you said, Mr. Boyle. And, their life's going to be a lot harder.
Thank you. See, my time's expired, so you'll back.
I thank the ranking member, and now yield 5 minutes to our vice chairman, Mr. Lloyd Smucker, also from Pennsylvania.
Thank you, Mr. Chairman. Thank you for holding this hearing. I think this is an important conversation to have as we consider what Medicaid should look like going forward, how we can improve the program to ensure that those who really need assistance can continue to receive that. And maybe I'll start by just saying I think most people, at least most people in my district, I can tell you for a fact, really are proud to be in a country where there is a safety net, where people who really need help, maybe it's temporary, maybe they are disabled, whatever it may be, where they literally need help. American taxpayers are willing to have their dollars go to assist people who really need the help, and I think most people up here would say the same thing. And then secondly, we want to ensure that every American does have access to health care, and hopefully can have access to good health care and affordable health care. But I can tell you what drives some of my constituents nuts, and that is if dollars are going to individuals who are here illegally and threatens dollars that should be going, threatens the program that is here for Americans. Every dollar going to someone who doesn't, who is here illegally, means that the dollar taken potentially from an American. And then secondly, they want people to do their part as well. If there are individuals who are not doing their part, who could be working and aren't, they're not in much mood to continue to provide that assistance to people who aren't doing their part. And to Dr. Gordon's part, he portrayed this as, or Mr. Gordon portrayed this as undue hardship on individuals who really are trying to make ends meet. And that's just not true, because it does not affect people who already have a job, the work requirements. And so you mentioned 90% are working. This doesn't affect those. What we're trying to do is ensure that everyone who is receiving dollars from taxpayers is doing what they can to ensure that they're doing their part. There's a survey that came out that I thought was really interesting recently. And this, again, this is not talking about every recipient of Medicaid, in fact, just a small percentage, but an American Time Use survey found that childless, able-bodied Medicaid recipients who do not work spend an average of 4.2 hours per day playing video games and watching TV. I'm going to repeat that. Again, this isn't talking about people, I know there are a lot of people on Medicaid who need that assistance, who are working hard to try to make ends meet, but this is a survey based on census data, found that childless, able-bodied Medicaid recipients who do not work spend an average of 4.2 hours per day playing video games and watching TV. So maybe let Mr. Stehle answer that. I mean, do you think that's an unreasonable expectation to have Medicaid recipients in that situation spend less time playing video games or watching TV? Is that cruel? Is that unrealistic?
Yeah, ultimately, I think that that's exactly why the work requirement in the One Big Beautiful Bill is generous. Because, if you have, 126 hours to game in a month, I think you can find a few hours to work, train, or volunteer. And ultimately, the goal there is, of course, that you become independent and you move out of dependency and free up those resources that are intended for the truly needy.
Mr. Dickerson, your organization put out a report recently estimating that over $1.1 trillion of Medicaid dollars were misspent over the past decade. That's a lot of health care coverage for a lot of individuals, if that's true. Can you talk a little bit more about that? I know that includes improper payments and essentially how we can get to reducing that.
Yeah, that's right. We co-authored that with Brian, actually. But over the last 10 years, they only actually enforced actual audits of states twice, right? During the Biden administration, the Obama administration, they didn't actually confirm eligibility and enforce those audits. So, but in the 2 years that they actually did full audits, the improper payment rates were enormous, really twice what the official reporting was in the other years. And so if you extrapolate what we actually measured.
I'm sorry, I'm out of time. Maybe you could submit an answer to that question, but I'm going to just ask this. Do you think do you think it would be fair to the American taxpayer if we don't do everything that we can to root out that kind of waste in the system?
Absolutely not.
Like I just don't think it's fair to the American taxpayer. Do you agree with that?
Enforce the program, yeah.
Yeah. Thank you.
Thank the gentleman. And now you have 5 minutes to my colleague from Texas, Mr. Lloyd Doggett.
Thank you, Mr. Chairman. Originally, I had really hoped that the Department of Government Efficiency cared about efficiency. But as with everything around Trump, it only cared about showmanship, not careful performance audits, but slash and burn destruction, where success would be measured by the body count of federal employees. Like a bizarre episode of The Apprentice, where you could say you're fired to public servants who served our country for decades. The hope that we would have efficiency was something that was totally lost in the "we found fraud" headlines, and yet DOJ failed to present one single case of actionable fraud for prosecution in this country. And of course, about 2 months ago, the DOJ success was so gigantic, so immense, that we were told that taxpayers all over this country would be getting a check, a dividend, a rebate from the DOJ savings. But of course, that claim vanished just as quickly as Elon Musk claims that he was going to have $2 trillion of savings. He cut it himself to $1 trillion, and the DOJ website has said it's down to 1/10 of his original claim at $180 billion. Still a significant amount of savings, though the American Enterprise Institute, a conservative organization, has found that claim is inconceivable, and that the DOJ savings, according to other groups, may actually be exceeded by the cost of DOJ. What about government efficiency? Instead of making our government smarter and more efficient for the American people, they took a wrecking ball to the Federal Aviation Administration, the Social Security Administration, the Consumer Financial Protection Bureau, even AmeriCorps and the Park Service. DOGE has impaired the ability of our government to provide the people of America the services that they deserve. Take the Social Security Administration. It is down to an incredible level of service at levels that haven't been experienced in many years, and seniors and those with disabilities cannot get the services that they deserve. The Internal Revenue Service and the permissive Republican attitude to tax cheats. IRS audits, auditors down a third of their workforce, back to 1950s level. The Committee for a Responsible Federal Budget estimates that these cuts will lead to a loss of $300 billion over the next 10 years. And this week, the Democrats on the House Judiciary Committee summed up the cost of President Trump's permissive attitude to crime. He seems to love some criminals. The total cost of his pardons to victims and taxpayers, $1.3 billion in restitution and fines that were owed. One of the great examples touches on the area we're talking about today, nursing home fraud. We have a fellow down in Florida who took the payroll taxes of his employees and he decided to use them to buy a yacht and some other things. For a judgment that he'd go to jail and he'd pay $4 million in restitution, but it was a better deal for his mom to give $1 million to the Trump campaign and get him off scot-free. Even DOGE itself, in the form of the artificial intelligence chatbot that Elon Musk set up, it analyzed the DOGE attacks on the Government Accountability Office, to which you referred, Mr. Chairman, in your opening statement, and pointed out that it saved $123 for every dollar that's been spent at the GAO. And so what's the Republican response? Cut the GAO's budget by almost half. The DOGE AI bot concluded House Republicans pushing a 48% cut to GAO's budget is like firing the watchdog because it barks at thieves. For once, the bot got it right. Now, there's some big savings that can be achieved, and they run into the hundreds of billions of dollars. But there's only one problem. You have to take on some special interest with a lobby, a limousine, and a big campaign finance fund. I have introduced multiple bills to attack provider fraud in Medicare, something that hasn't come up much today, and in Medicaid. It doesn't take outlandish claims about 350-year-old recipients like the president made in his incredible comments to the Congress. It takes having the guts to stand up to those special interests. And a bill that I introduced this week that actually did have some courageous Republicans join it would save $350 billion by not letting Medicare Advantage take premiums while the Veterans Administration provides all the care. Twice the savings that DOGE itself claims that it achieved. We need to do the hard work, particularly focus on provider fraud, provider inefficiency, and waste. That will be much more effective than what's been wasted on DOGE, and I yield back.
I think the gentleman from Texas yield to the ranking member.
Yeah, thank you, Mr. Chairman. Seek unanimous consent to submit some reports for the record from Keep Americans Covered, the Commonwealth Fund, and Families USA. First is a report by Keep Americans Covered titled, Washington Post Report Undercuts Wildly Exaggerated Claims of Fraud in Individual Marketplace. Second is a report by Keep Americans Covered titled, CAC Response to Paragon Paper. The third is a report by the Commonwealth Fund titled, How Medicaid SNAP Cutbacks Would Trigger Job Losses Across States. And finally, a report by Families USA titled, Working America Relies on Medicaid. Congress must protect essential workers from devastating Medicaid cuts. So ask unanimous consent to submit these 4 reports for the record.
Without objection, so ordered. Now, we yield 5 minutes to my friend, Mr. McClintock from California.
Thank you. I'd like to begin by underscoring the chairman's point that according to the CBO, the only people who would be kicked off Medicaid under the BBB are illegal aliens who have no right to be here, or Americans who are either ineligible under existing law or who are able-bodied adults who refuse to look for work. And meanwhile, Medicaid's costs have ballooned at the expense of taxpayers and of the aged, blind, and disabled that these programs were designed to support. Mr. Gordon, I want to be sure I understood your background correctly. You were a senior official at the New York City Department of Education? And you played a key role in Michigan's response to the COVID pandemic. And you're the Democratic representative among our witnesses today. I hope you'll pardon me for saying so, but you seem to be the typhoid Mary of public policy. Mr. Dickerson, you know, I was in the California legislature when Bill Clinton ended welfare as we know it and instituted a work requirement for those who were on public relief. My memory of that was that there was a dramatic reduction in welfare rolls nationally, a dramatic increase in Americans working, and an improved standard of living and quality of life for those who did. Ironically, in California, those work requirements were gutted at state-only expense, and the result was very little movement off the welfare rolls, ballooning costs relative to the states that implemented these reforms. So this isn't a theoretical question, is it? We have actual experience with what works and what doesn't. Could you tell us the actual experience when Bill Clinton approved of work requirements for welfare programs?
Yes, that's exactly right. And President Clinton at the time and then Senator Biden supported welfare reform, and it was a common sense bipartisan effort to move people off of welfare into work, and that's exactly what happened in the TANF program when we changed the open-ended AFDC to TANF and gave states flexibility to implement programs tied to a work requirement.
And then what happened? Why don't we have those work requirements today?
Well, they've been gutted in many programs, and in many cases, states have shifted individuals from TANF over to other federally funded programs like Medicaid, like food stamps, and that's basically replaced welfare that we understood in the 1990s.
And even if there was no change in behavior, no movement, I still think there's a justice issue involved as well. You know, many families are working their hearts out, sometimes at multiple jobs, in order to afford to pay their bills and their taxes. How is it the least bit fair to say to them, you have to work and toil and make bread so that somebody who's not even willing to look for work can eat it? How is it fair that one class has to work their fingers to the bone to pay for those who are able but unwilling to spend just 20 hours a week working, or at least looking for work, or at least training to look for work?
It simply is not fair. I mean, I think nobody is opposed to giving a hand up, but a permanent handout it creates dependency, and that has terrible consequences both for individuals and families, but also broader society.
The Democrats love to talk about fairness, but their policies are exactly the opposite. Dr. Blase, you mentioned the game that California's played with Medicaid payments. As I understand it, they raise taxes on providers. They use those taxes to qualify for additional federal matching funds, and then they reimburse the providers and use the money that they had skimmed from this process to pay for Medicaid coverage for 1.6 million illegal immigrants in California. Do I understand that correctly?
That's correct. The state taxed managed care plans that participate in Medicaid. They then returned all of that money back on the managed care plans. So that was just the accounting gimmick. They invoiced the federal government for that accounting gimmick, and they obtained $10 billion. The next year, California expanded Medicaid to illegal immigrants in the state.
And California is now on the edge of bankruptcy once again by programs like this.
And unfortunately, other states followed California's lead and got similar type scams approved. And one big beautiful bill does shut that down.
And this comes out of the federal funds that would otherwise be available to support those that the programs were originally designed for, the aged, the blind, the disabled, or those who are unable to work.
That's right. And Vice President Biden called this a scam. He said it should be eliminated, and it is just an abuse of federal tax dollars.
It's shocking how much farther to the left the Democrats have shifted in just the last year or two. Thank you. I yield back.
Mr. Chairman, if I might, before we go to the next witness, we have, all four of the witnesses have kindly taken of their time to testify as our witnesses, guests of this committee, including Mr. Gordon. I think we can disagree without being disagreeable. He really doesn't need an attack on 30, 40 years of his work, and he should have the opportunity to respond. We certainly appreciate that.
Dr. Gordon, if you want to respond, you get a few seconds here, but make it quick, please.
Sir, you referenced my time in New York City. I worked on a budget reform, was a bipartisan idea. I was working for actually Mayor Bloomberg was Republican at the time. That reform has survived multiple mayors. It's got broad support, was a good thing. I have worked across the aisle whenever possible across my career, and I'm sorry you felt the need to take a cheap shot at me.
I thank the gentleman now
Again,
yield.
I took a shot at the policies that you have advocated.
Thank the gentleman from California. Yield to, we got a lot of Californians on this committee, I think. Jimmy Panetta from California in 5 minutes.
Thank you, Mr. Chairman. Thank you, Ranking Member. And gentlemen, thank you for taking the time to be here. This last weekend, I was in the district, and I met with a group of doctors from the northern part of my very elongated 19th Congressional District in California. And I can tell you, the proposed provisions of the reconciliation package really scares the heck out of them, especially in the 19th Congressional, where healthcare has already reached a breaking point with providers who are leaving the market and, unfortunately, patients who are just not able to count on reliable access to care. Obviously, as you know, in our state, 53% of hospitals are already losing money every day caring for low-income patients. And even under the best circumstances, Medicaid only pays 80 cents on the dollar. The California Hospital Association estimates that Speaker Johnson's reconciliation bill will lead to a 39% increase in uncompensated care and an additional 1.8 million uninsured Californians. That means more cost to our local hospitals, longer lines for services, and yes, unfortunately, hospitals actually closing their doors for good. And I think we can all understand that when a hospital closes, that means it closes for everyone. Now, another thing is, although Medicaid's role in insurance coverage gets most of the attention, the program does far more than that. It's the country's primary source of financing for nursing home stays, and more broadly, it pays most of the costs for medical and non-medical services for long-term disabled of all ages. In 2022, Medicaid spent an average of $21,000 per person on elderly and disabled, and just $5,000 for children, single parents, and non-disabled adults under 65. Unfortunately, some of the reconciliation bill's lower profile provisions affect these aspects of that program. So whether you support the Medicaid program or not, the way this reconciliation bill is written will lead to more red tape and less health care, not just for the vulnerable, but for everyone. Now, I get work and reporting requirements, and I think we all believe in the dignity of work, but I also believe we need to be very careful in how these requirements are implemented, as they could lead to people unnecessarily getting kicked off Medicaid. I'm not just saying it, there are hard examples of this. In 2018, the state of Arkansas implemented work and reporting requirements, but it was forced to abandon the program just after 4 months because in that time period, limited time period, 18,000 people were unenrolled and the uninsurance rate increased to 4.4%. In 2024, as we heard today, the Georgia work requirement experiment cost taxpayers more than $86 million. In Michigan, Mr. Gordon, when you were director of the Department of Health and Human Services, you struggled to implement Medicaid work requirements, and 100,000 Michiganders ultimately lost their health coverage. Mr. Gordon, do you know how many of those 100,000 people lost coverage because they were actually ineligible, and how many got caught up in additional red tape?
The best research on people losing coverage based on eligibility is out of Arkansas, where 18,000 people lost coverage, and there were extensive surveys of thousands of people. Best estimate is that 95% of the target population was eligible for coverage, and yet That's, I think, a third of the 18,000. I'm sorry, so the 18,000 is 3 or 4 times that number. So the vast majority of the people who lost coverage in Arkansas were people who were eligible under the law. And you can see why in the story that I told, in stories of the implementation of Medicaid work requirements in Georgia. These are complicated requirements to comply with. They put large demands on states around execution. States, as I think people in this room normally recognize, are not perfect at implementation. They make mistakes, particularly when budgets are being cut, particularly when tight timelines are being set. And inevitably, there are vast numbers of errors. That is what we have seen in Arkansas. That's what we saw in Georgia. And that is absolutely what we were on track to see in Michigan.
And look, I appreciate this hearing because I do think it demonstrates that the reconciliation bill will reduce taxes in a disorganized fashion, with most of the benefits accruing to the well-off. And to partially pay for this plan, what we're seeing is that this bill would impose more restrictions on access to Medicaid. I'm not just saying it, but according to the CBO, you got households with incomes in the bottom 10%, which see a reduction of 4% of the resources in 2027, while the top 10% would see a 4% improvement. That's not right. That's why I will continue to vote against this package. Thank you, Mr. Chairman. I yield back.
I thank the gentleman, and now yield 5 minutes to Mr. Norman from South Carolina.
Thank you, Mr. Chairman. I want to thank the panelists for taking the time to come. My good friends on my left, on my right, but on the left, were saying that how waste, fraud, and abuse should be nonpartisan. We agree on that. But now, when it comes down to doing anything about it, where's their voice? When the flood of illegals that were coming into this country from all over, Mr. Stehle, many were taking the place of your child who should not have received benefits. Where was their voice against the mass illegal? Silence, said nothing, did nothing. When the fentanyl deaths killed so many of Americans because of the illegals, where's their voice? Silent, did nothing. When we identified, we had a man who identified waste, fraud, and abuse. His name happened to be Elon Musk, who didn't charge anything. Where was their voice? Their voice was against it. And how can you be against, if you look at what he identified, $2.5 million for electric vehicles in Vietnam. Mr. Stehle, that's taken away from funding for Medicaid for those who should get the funding. $6 million to fund tourism in Egypt. Where's the voice against that? No, they just criticize the messenger, which is just wrong. On the work requirements, 20 hours a week. We're having to fight for that. 20 hours a week. Ask any plumber, any business owner, any electrician. Do they work more than 20 hours a week? Many work, instead of 80 hours a month, they work 80 hours a week. So I appreciate what y'all are doing to back this bill. Is it perfect? No. Should it have more cuts? Yes. But to classify cutting Medicaid, we're writing a system that has increased, in the Medicaid case, 50% from 2019 to 2023. It's soon to be $1 trillion expense. And I hate I had to go to leave, but Mr. Blase, you want to just touch on how the dollar amount itself for getting the illegals off the rolls and the work requirements, as little as it may be, getting at least that put in, how it affects the system?
Yeah, thank you, Congressman Norman. So I think it's important to say there are not Medicaid cuts. Medicaid spending will grow year after year. What we're talking about is creating a more sustainable program that better serves those who truly need it. And the program, because of terrible incentives, has been flooded with waste, fraud, abuse, and corporate welfare over the last several years. The federal government has a particular interest in the Obamacare expansion population because they are paying $9 for every dollar that the state contributes, and there's a federal equity there. And so the work requirement provisions focused on the Obamacare Medicaid expansion is a very reasonable requirement, and it's a way to help people incentivize work, because fundamentally, we want fewer people on the Medicaid program. The Medicaid program is not where able-bodied working-age people should be getting their health insurance. They should be getting their health insurance through their employer or through the individual market. So I think a level of success is, are we taking people off of welfare to receive their health insurance, and they're getting coverage because they have a job and they have insurance through the workplace, or they're purchasing in the individual market?
Plus they're paying taxes for the economy
Yes.
to pay for these services. Mr. Stehle, thank you for bringing your personal situation into it. It puts a face on it. Would you like to say anything else on why you did, what brought you here to begin with to do this?
Yeah, no, I appreciate that question, and I'll try to be brief. So ultimately, it's because I have the ability to help give voice to the greater than 700,000 people with disabilities who are, at this point, struggling silently. Most of them do not have a voice. We have a support system, but not everyone does, and these home and community-based waivers are sometimes the only thing that stands between those individuals and institutionalization. So ultimately, these policy decisions that have been made have created these perverse incentives where states want to enroll able-bodied adults over people with disabilities. And so I appreciate the opportunity to testify, because I think that the decisions made by this Congress could ultimately help restore Medicaid to its intended purpose.
And to provide help for those who really need it, which is what we're trying. Thank each and every one of you. Thank you for what you're doing. I yield back.
I thank the gentleman and now yield 5 minutes to Ms. Bonnie Watson-Coleman from New Jersey.
Thank you, Mr. Chairman. Thank you to our witnesses. Appreciate you being here. I have a couple of things that are really on my mind. First of all, Mr. Steele, I understand from a very personal perspective what you're going through. I have a bonus grandson who is autistic and nonverbal. His parents are well able to take care of him, but they are definitely looking for better services that could help William grow and be the best that he can be. So God bless you, and God bless your son and your family. You know what? I've heard a lot of misleading comments made by my colleagues on the left-hand side of this dais, not on the left-hand side of my ideology, that's for sure. I'm not even sure why they continue to bring up this big, bold, beautiful billionaire bill, because all of the polling that I see says that no one supports it, and even their own constituents don't support it when they recognize a harm that it's going to create for them with regard to losing their health care. And I don't care what they say. You can say misleading statements, and you can lie, and you can lie, and you lie, but it never turns it into truth. Because nonprofit, nonpartisan, expert organizations and people have said that this proposal will eliminate the health care for at least 14 to 16 million people. It will reduce the SNAP benefits to somewhere between 2 and 4 million people, and it will increase the debt by $3+ trillion. So everybody can't be coming to those conclusions, with the exception of those who are following in the missteps of an incompetent, incoherent, cognitively impaired president that strikes bombs on people who are not bothering us, and decides that he's going to have a cryptocurrency and other big things happen to him so that he can make money on his presidency. So I'm for waste, fraud, and abuse. I think that Elon Musk created more abuse, did not create any efficiency, and has backed off of the president simply because he has big contracts. So you want to talk about waste, fraud, and abuse and corruption? I'll talk about it every day of the week. Mr. Blase, hi. Let me ask you a few yes and no questions so I can get through this, because I have something I want to wrap up with. Did you receive a $20,000 PPP loan in May of 2020 for your for-profit consulting firm?
Yes, I did.
Okay, did you pay it back?
The loan was forgiven.
The loan was forgiven. Well, what do you know about that? Why was the loan forgiven?
Well, that was part of the PPP program.
In some instances.
I had just started a small business a few months before the pandemic.
Oh, okay.
And
So you were like
Congress-
new at this. So did you purchase a house for almost $700,000 soon after getting that loan?
My family moved from.
Is that a yes or no, sir?
Well, we sold a house for more than what we bought our house
Okay.
for. So we did move to the state of Florida in part because.
Do you receive a salary from the Paragon Health Institute?
The Paragon Health Institute? Yes, I'm the president
Do
of Paragon
you-
Health Institute.
Okay, are your speaking costs stated to be somewhere between $10,000 and $20,000? Speaking engagements?
That is a very high end.
So is that a yes or no?
That is.
Is it more than, is it 10?
No, I do not. That is not what I charge for speaking.
Okay, what do you
engagements.
charge?
I don't have a standard
Okay.
rate that I charge.
All right. Let me say that it concerns me that we continue to have these redundant hearings on what is one of the most damaging pieces of legislation in our political history, in our government history. Let me just say that we can put lipstick on a pig and give it some wings, but it ain't gonna fly and it's still a pig. And that is exactly what this big, beautiful billionaire bill represents. Mr. Chairman, not Speaker, I am going to ask unanimous consent to enter into a portion of the Millbank Quarterly dated April 2024 that says, and speaks to something that our witnesses said, within the small slice of non-working adults who can be considered able-bodied 4 and 5, that's 79.2% are women, with an average age of 41. 1 in 4, 26%, is over age 50. Their median income is 0. They live in families with annual incomes averaging under $45,000 a year and an average household size of 4.4. In other words, they're exceptionally poor women on the older end of this working age spectrum who have no income of their own and live in poor families.
Without objection, so ordered.
Thank you, ma'am. Thank you, sir.
Okay.
I yield back.
Next up, General Jack Bergman for 5 minutes from Michigan.
Thank you, Mr. Chairman. Dr. Blase, I'm going to ask you a question in a couple of minutes, but the question is going to be, can you please describe the benefits of work requirements in Medicaid and the benefit of work requirements more generally in welfare programs? But before I ask you to answer that question, I'd like to focus a little bit on the dignity of work. As anybody in the military, but government too, we love our acronyms. And in this case, dignity of work is Dow, not the Dow Jones average, not, Dow Chemical Company. This is about human dignity. And I'm asking I'm going to make the statement, but it's based on questions asked of me by my 10 grandchildren, ages 23 down to 16. When they ask why, the single, I believe, human trait or personal trait we can have, other than have integrity and a belief in something higher than us, is to have that curiosity that leads us down roads that we never would have traveled down unless we had the confidence and resilience to be curious. How do we get curious? Well, some of us are naturally curious, but I would suggest it to you, the sooner a young child, and this is again referencing my grandchildren when they ask, Papa, why this, why that? How did this happen? They all started their first jobs when they were old enough to either be
in an unpaid status by their parents, take out the garbage, make their bed, be a responsible member of the family. But they ask on their philanthropic side at a young age and volunteering in everything from soup kitchens to, school situations, why is it that everybody doesn't work? And even at a young age, but that dignity of work leads to resilience. Think about a resilient 6-year-old or a resilient 16-year-old, more importantly, that has to deal with all the issues that you have to deal with in middle school and high school. So when we think about a road to resilience, it starts with human dignity that we have inside us. The resilience leads to confidence, and it leads to a more fulfilling life for all of us. Because if we're going to help others and give from our personal bucket, we have to fill our bucket first. How do we do that? Well, how about if we put a little skin in the game? So having said that, would you now explain to me what I asked you as far as how the dignity of work is increased and validated for human beings of all ages?
Well, Congressman, I think you said that very well. Humans want purpose out of their life, and productive work is a big way that people get purpose. I think with respect to the work requirements in this legislation, they are narrowly targeted to able-bodied working-age adults, and they can be met through work, through job training and education, or through community service, all of which helps get people a sense of purpose and dignity. And I do think one of the really important parts, because there's been issues of how they would be implemented, when Arkansas implemented their work requirements, that was 7 years ago. The technology changes over the past 7 years, the improvements, the growth of artificial intelligence. It's like infinitely different technological environment now in order to ensure that there is compliance with the work requirements. But I think to your broader point, yes, there are a few things that give as much purpose to life as work and community engagement. And we've lost community engagement in this country, and I think that is a real problem.
Yeah, well, thank you. And, we've all heard the saying, I'm from the federal government and I'm here to help. Okay, we know how that sells in a lot of cases, or the real purpose. Well, I think in this case, for the federal government to create the environment where the dignity of work and therefore the human resilience and all of those feelings that we do need inside us to be good human beings and look in the mirror and feel good of ourselves, that's a great step for the federal government to do that. And with that, Mr. Chairman, I yield back.
I thank the gentleman. Now you have 5 minutes to the gentlelady from the Virgin Islands, Ms. Stacy Plaskett.
Thank you very much, Mr. Chairman, and thank you to the witnesses who are here today. I've heard a lot of discussion from my colleagues with regard to waste, fraud, and abuse. And for many years, I was a Republican, worked in a Republican administration, and part of that ethos for myself was related to waste, related to overstimulated bureaucracy, the inability of corporations and small businesses in particular, as well as individuals, to be able to navigate a system that is set up to create blocks for them and to create blocks for economic development throughout our country, and that it's bloated. But I also do not believe that we should strip entirely a system when we are not looking at some of the greatest abusers of waste, fraud, and abuse. I also sit on the Ways and Means Committee, and in that committee, we have seen absolutely no discussion about waste, fraud, and abuse on cracking down on that when it's perpetuated by wealthy individuals and corporations through our tax system. They keep tax laws riddled with loopholes. The big, beautiful bill as it's called, is beautiful to wealthy individuals, to corporations, because they keep tax laws riddled with loopholes so that the rich can exploit them, while slashing IRS staff and funding that could catch wealthy tax cheats, despite the IRS already being underfunded for decades. They are doing this while at the same time wanting people to forget or saying, don't look at the thing that's right in front of you. That's not really what it looks like, that they are using backdoor methods to strip healthcare and food assistance for millions of Americans. We have seen here in Congress how we, in the Ways and Means Committee at 3 o'clock in the morning, had almost an hour debate about let's not change the tax rate for individuals making over $500 million a year, so that we can save some of the individuals who are involved and need the support of our healthcare system. To a person, my colleagues on the right said no. That's not being committed to waste, fraud, and abuse. That's being committed to stripping the poorest to make way for the richest. That's what's really happening here. Let's not forget how they attempted over many years to get rid of what they call Obamacare. The fact that it was named Obama in itself became a dirty word that was kind of a backdoor way of dog whistling for people that we've got to get rid of it. So that's, to me, what I think is really important here. I live in a district in the Virgin Islands where I know we are going to be destroyed as a people because so many individuals rely on Medicaid, do not have the ability to navigate these systems at the rate at which my Republican colleagues are requesting, that our hospitals, our rural hospitals, which rely on Medicaid payments because a third of our people live in poverty, are going to be abused. Now, Mr. Gordon, you know, one of the things that I continually tell people when they ask me about what's the rationale behind a lot of things is follow the money. Because unfortunately, with this administration and with our president, more often than not, I can trace it back to how some corporation, some individuals are going to make out at the behest of any of the policies and the actions that are done. You said, Mr. Gordon, in your opening statement, which I really took note of, the growing and the ability to have a burgeoning private sector system that is going to make money. Can you explain that to us based on this bill?
Yeah, thank you, Representative. States rely on vendors for key information, and the way the bill is set up, it will be difficult for them not to rely on vendors. There are different decisions that could have been made that would have enabled the public sector to handle more. This is a case, and I believe there are members of the Trump administration who understand and believe this, that the government often spends on expensive, overpriced contractors when it could do the work itself much more cheaply. You hear that from people in DOJ, actually. And this bill, unfortunately, makes decisions that will not enable government to handle things like verifying income in a timely enough way for the requirements in the bill, or standing up systems in a timely enough way for the requirements in the bill. So the late decision that was made to move up implementation to from 2029 to 2027, I'm sure that maybe that helped hit some budgetary target for folks, but not only will it cut people off of healthcare sooner, it will make implementation far more of a mess. And it will lead to far more reliance on private vendors. I think it will lead to far more reliance on private vendors that will profit handily from this situation.
Thank you very much. Follow the money, people. I yield back.
I thank the gentlelady and now yield to my friend from Texas, Mr. Chip Roy, for 5 minutes.
I thank the chairman, and I do agree we should follow the money. Mr. Dickerson, the House bill that we passed not long ago, this chart reflects your view of what the House bill would do. Is that correct?
It does.
Significant amount of front load in this chart, correct?
Yes.
Meaning there'd be significant amount of deficits in the first 5 years, and you're having to hope to get savings in the out 5 years.
Correct.
Net dynamically scored, assuming the House Budget Committee's 2.6% growth of $2.5 trillion of additional revenue, we would still end up at a negative $72 billion deficit over 10 years. Is that correct?
Yes.
Now, The question right now is, what is the Senate bill doing? What's the impact of the Senate bill? So would you agree that based on what we understand from the Senate bill currently, that we would have in total upwards of maybe $1 trillion of additional deficit added if we follow what we believe the current Senate bill is going to produce?
Yeah, the Senate bill is definitely backsliding.
Now, to get there, let me explain it real quick and walk through the chart. It fails to terminate the Green New Scam subsidies completely, correct?
Correct.
The House bill left roughly 40% or $400 billion totally untouched, but the Senate bill waters down massively the 60%, which would cost us a fairly significant amount. The Bipartisan Policy Center says $46 billion. We think it would be a lot higher, correct?
Absolutely.
Now, let me touch on healthcare for a second. The Senate bill, based on what we're currently being told, would have some savings in Medicaid reforms. Mr. Blase, is that correct?
That's correct.
Those are pretty significant reforms in the sense that they're at least pulling back on the provider taxes so that you can at least dent the money laundering scam you referred to earlier. Is that correct?
Yes.
So, but does that go far enough to actually undo the money laundering scam? Does the current Senate bill go as far as it needs to go?
It reduces the safe harbor to 3.5% in the expansion states. It reduces the state-directed payments, current and new ones.
To the point, though, of Nick's testimony earlier, do we actually get to the heart of the Medicaid money laundering scam if we do not touch the FMAP 7 times multiple that you described in your testimony?
So it does not address that provision, and I think that is a major problem in public policy, is that we're paying 7 times more for able-bodied than traditional enrollees.
That's not to suggest this isn't an improvement. It is to suggest that we could save hundreds of billions of dollars more if we were to touch the FMAP scam that is currently going on.
I think
Is
the
that correct?
Senate bill is an improvement, but it leaves the problems with the 90% match rate in place, correct?
Appreciate that. Another point, and Mr. Dickerson, SNAP, food stamps, right? We end up with $137 billion add in the Senate products, correct? Both because of policy choices they made and the so-called birdbath. Is that correct?
Yes.
We also have an addition of higher education of $30 billion based on choices made in the U.S. Senate, not birdbath, correct?
That's right.
We also have additional spending of another $18.5 billion that have been littered in various committee products, correct?
Yes.
We have another bit of law savings, including $24 billion by choice, not birdbath, not parliamentarian, choice by the Senate not to have remittances use their banking facilities to go after those that are legal aliens funneling money out of the country, correct?
That's right.
And another $12 billion that goes into the pockets of tobacco companies and certain tobacco companies, correct?
Yes.
We have over here RICA. We have a fund that is $6 billion that was added in the Senate Judiciary product, which would be limited to $6 billion on paper, but we believe it would have a massive expansion over the 10-year window of a good $15 to $20 billion a year. Is that correct?
It sets us a huge cliff in 2 years.
And so then here, the last point, tax extensions. The assumption currently is that a lot of these taxes would either fall off a cliff and expire, and we have tax permanence being put in place in the Senate, right?
Yes.
But they do a policy baseline score. We're trying to do math. That's a $400 billion delta, correct?
Yes. Many of those are good policies, but it's still,
Correct.
it's
We
still a
agree in
fiscal
those
effect.
extensions, but that's a $400 billion delta, correct?
right.
That doesn't include salt because the Senate bill says that they're going to take salt down to 10,000, correct?
Which is good.
Which would save $339 billion, and we agree with that, correct?
Absolutely.
Right, but based on what everyone in this town is saying, do we expect that to occur?
I think it's unlikely, given
Right. I've been
statements
told-
of some members.
I've been told by House leadership, ain't no way that's going to occur. So the real tax dollars are going to be the $339 billion. Let's add guilty, let's add the 199A. That's how you end up with $1 trillion of additional deficit if the Senate products are what are adopted and comes back over to the House. We can't end waste, fraud, and abuse if we continue to fund the people that are engaging in the waste, fraud, and abuse. I yield back.
Will the gentleman from Texas remind me what the provision we put in the resolution in the House and the commitments in the House on the balanced budget reconciliation principle? Can you just remind me of
The framework in the House?
Yeah, just as it relates to potentially $1 trillion in additional cost in the
The
Senate.
framework in the House, which I applauded the chairman for and many of my colleagues, was to say that dollar for dollar, right, we should have spending cuts matching the tax cut score. We appreciate the policy choices of permanence and not, frankly, the gimmick of a cliff. But if you're gonna do it, you've gotta have the spending restraint or you're gonna have deficits. There's no mathematical way to avoid that, no matter what they do with the policy baseline choice in the Senate. Math is still math.
Would that violate the amendment we had in our resolution?
I believe it would. There's going to be people who are going to say that that you can adjust the numbers a little bit to get within the concept of the framework. I think it would significantly violate the House framework.
I appreciate everybody indulging me in that point of clarity. Now we're going to go to Mr. McGarvey from Kentucky for 5 minutes. Thank you for your patience.
Thank you, Mr. Chairman. I will just jump right into it. There's no debate on this committee that millions of Americans are going to lose their health care. The only thing we're debating is how many millions of Americans are going to lose their health care. But we're not actually debating that millions of Americans are going to lose their health care. This means kids. This means pregnant women. This means veterans. This means seniors. This means people who are depending on having health care to live healthy lives. We're talking about who it impacts directly. But we've not spent a lot of time in this committee talking about everyone this impacts, because this will have an impact on everybody. Look at my state in Kentucky. The list just came out that if this bill goes through, we will close 35 hospitals in rural Kentucky. 35 hospitals are going to close in my state. What does that mean? First of all, over 20,000 jobs will be lost, according to the president of the Kentucky Hospital Association. Not exactly a liberal organization, guys. You're going to lose health care. If you live in Fleming County, Kentucky, right now, you can go to the Flemingsburg Hospital. It's right there in Flemingsburg. If it closes, you have to go to the St. Clair Hospital in the county over. Now, Google Maps tells me that's 27 miles and 35 minutes. But guess what? That hospital is also on the list to be closed. So if you're living in a place in Kentucky right now that's already lacking for medical care, picture it. It's your parent who has a stroke. It's your spouse who has a heart attack. It's your wife who goes into labor prematurely. What are you going to do when minutes matter? And because of this bill, we are closing 35 hospitals. Already in my state, 41 counties out of 120 don't have a hospital. 72 counties don't have an OBGYN. 48 counties don't have a pediatrician. You're getting rid of 20,000 healthcare jobs and 35 hospitals. It is going to have an incredible impact on everyone's health and well-being. And for what? Well, Mr. Roy actually just gave you a little bit of a preview. It's to give a massive tax cut to Donald Trump's billionaire donor buddies, to drive up the debt in the process, and to take health care away from hard-working Kentuckians, seniors, kids, veterans, people who are working in communities where their hospitals are going to close. Mr. Chairman, I would like to introduce this list into the record to make sure that people can see it.
Without objection, so ordered.
Because a budget is a moral document. It's a statement not just of our values, but who we value. I value the hardworking men and women in my state. I value the people who are struggling to get by. I value the people who are counting on the hospitals in their rural counties to get health care. Not already the richest Americans who are going to get a tax cut under this bill that's going to drive our debt up and take health care away from people. It's wrong. It's indefensible. It's reprehensible. As Josh Hawley said, it's morally wrong, and I don't think the people in my state are just going to get over it. So, Mr. Gordon, I have a question for you. Do you think that these rural hospitals are a waste? Is getting care at the Fleming County Hospital somehow committing fraud? Thank you. Will this proposal that we are talking about today cause disproportionate harm on our rural communities?
It will severely injure rural hospitals and
Yes,
rural healthcare.
in my state, 35 hospitals will close in a state where 41 counties do not have a hospital currently. Mr. Gordon, when confronted about cuts to Medicaid, there are United States senators who said things like, well, everyone is going to die and that people will just get over it. Do you think rural communities will just get over it if their hospitals really close? And what are the trickle-down effects of this in the time you have left?
I think rural hospitals first of all, provide healthcare that people badly need, where they need it, when they need it. And second, they are often critical economic engines that drive a lot of economic opportunity and activity for people who don't work in them. And so you lose rural hospitals, you take a big bite out of rural America.
Under this bill, we are cutting healthcare, we are cutting healthcare jobs, we are cutting healthcare facilities, and we are doing it so the richest Americans can get richer while driving up our national debt. It is wrong, and we must do better. Mr. Chairman, I yield back.
I thank the gentleman from the Commonwealth, and now yield 5 minutes to my friend from Kansas, the pride of Kansas, Mr. Ron Estes.
Well, thank you, Mr. Chairman, and thank you to all our witnesses for being here today. American people and more than 750,000 Kansans gave President Trump a mandate to bring major changes to Washington. His Department of Government Efficiency identified unprecedented levels of waste, fraud, and abuse within the federal government, sometimes to the tune of tens of billions of dollars. House Republicans, one big beautiful bill, removes waste, fraud, and abuse within Medicaid and the SNAP food stamp program, empowers able-bodied adults to work, and more importantly, puts American families like the ones I represent in Kansas first. We owe it to current and future generations of Americans to strengthen our federal programs so that those who truly need benefits can receive them. This should not be controversial. It's how the programs were originally intended to work. Improper payments in Medicaid have consequences. These misspent dollars could have gone to Americans who need health insurance coverage. Since 2015, an estimated $542 billion have been improperly paid in Medicaid. That's enough to cover the health insurance of 6.3 million people, more than twice the entire population of the state of Kansas. The common sense reforms that my colleagues and I have put into the One Big Beautiful Bill will benefit the American people and our program beneficiaries. Mr. Dickerson, in 2024, the USDA reported an average national payment error rate of 11.7%. This rate nearly doubled since 2019. Some of our colleagues have tried to downplay the severity of this problem. What do you think it's so important to address, and how will the reforms in H.R. 1, the One Big Beautiful Bill, help reduce and prevent improper and fraudulent SNAP food stamp payments?
Yeah, that's right. And we know actually the number is actually much higher because USDA has been instructed in the 2014 Farm Bill to ignore certain improper payments. And it's completely unjust for exactly the reason you laid out, because it's taking money away from people who shouldn't, who should be getting those benefits, and taxpayers who have better uses for that money rather than going to waste, fraud, and abuse. The One Big Beautiful Bill does take important steps, right? It actually gets rid of the provision that says don't count the money. And then importantly, it gives states skin in the game for the first time to try to administer their programs correctly.
Oh, thank you. Mr. Stehle, your op-ed touched on the importance of work requirements in Medicaid, as well as, your testimony today was really touching in terms of talking about how you and your family are personally impacted, and your son. Can you share more about how Medicaid work requirements for able-bodied can help benefit America's most vulnerable?
Sure. Thank you. Thank you for that question. So ultimately, by freeing up these resources, states will have the ability to pay down the waiting lists, and they can start to direct more of that money that they would be spending on able-bodied adults, on people like my son who are languishing on these waiting lists. And we know that from FOIAs just in a handful of states where they replied, we know that 39,000 people have died while waiting on these waivers on the waiting list. So ultimately, this has been talked about, but work is transformative and there's dignity in work. And so it's not just helping people like my son. It's not just helping truly needy, truly vulnerable, but it's also just good for all of us, because when people move out of dependency and move into work, that's when they can start to fulfill the American dream.
Yeah, well, thank you. I mean, you pointed out what's true in my home state of Kansas. Our state legislature has resisted the expansion of Medicaid because we have a waiting list for the disabled and the less than 100% of poverty level. And we think those individuals ought to be treated first and allowed to be enrolled and receive those benefits before able-bodied adults are entitled to those benefits. Mr. Blase, I'm going to ask you kind of an open-ended question here is whether that you can answer whether it deals with waste, fraud, and abuse or work requirements or whatever. It's just, how can the one big beautiful bill that the Republicans are promoting help strengthen the Medicaid programs and ensure that it exists for years to come?
So first, checking eligibility. The big problem with improper payments is that the Biden administration just made it more difficult to remove people that weren't eligible for the program, and so it would do more frequent eligibility reviews for the able-bodied population, which is really important when the cost of that population is almost entirely borne by the federal government. States have really bad incentives around the expansion because of the economics. So just checking eligibility is a big piece of that, and then putting in place the work and community engagement requirement.
Well, thank you. And I think it highlights in general just every dollar we save through waste, fraud, and abuse is a dollar that can go to the benefits of those people that really need it. With that, Mr. Chairman, I yield back.
I thank the gentleman from Kansas and now yield to my friend from Texas, Ms. Veronica Escobar, for 5 minutes.
Thank you, Mr. Chairman, and thanks to the witnesses for spending your time with us today. I actually appreciate every opportunity we have to talk about the Republican reconciliation bill, because frankly, the more that the American people learn about it, the more they hate it. So I think it's important that we're honest with the American public. I think it's important that we continue to educate them so that they understand what my colleagues on the other side of the aisle are really trying to do. They may say that this bill will enhance Medicaid, but frankly, that's not what is happening here. And you don't have to take our word for it, those of us on this side of the dais. Let's look at what Susan Collins, Republican senator, has said. She has sounded the alarm on the fact that hospitals, nursing homes, and clinics will be deeply impacted by these cuts. Josh Hawley, Republican senator from Missouri, he's sounded the alarm on these cuts, called it immoral. He's even called this a rural hospital defund scheme. That's both of those folks, Republican senators. And Tom Tillis this week passed out this flyer to his Republican colleagues. And Mr. Chairman, I'd like to enter into the record Senator Tom Tillis's flyer.
Without objection.
Thank you so much. Basically warning that Virginia, Louisiana, South Carolina, Tennessee, Kentucky, Ohio, West Virginia, Missouri, Iowa, North Carolina will all suffer under these cuts. And for his own state, at the bottom of the flyer, he writes, Medicaid coverage for over 600,000 North Carolinians would be at risk. So you may not take Democrats' word for it, that these cuts will be actual cuts to benefits. So take Republican senators' words for it, because they are laying it out pretty clearly. And look, I'm all for eliminating waste, fraud, and abuse. You will find no one in this room supports waste, fraud, or abuse. Frankly, that's why I was so alarmed that President Donald Trump fired the Office of Inspector General in charge of rooting out waste, fraud, and abuse at HHS. And he, in fact, nominated instead a Republican lawyer who he himself has been accused of misusing taxpayer funds. So all of us who are concerned with waste, fraud, and abuse, I hope all of you will uplift the concerns that we have at the firings of those government watchdogs who've been rooting out waste, fraud, and abuse. I think the other component that is really being glossed over here about this massive transfer of wealth from the poorest Americans to the richest Americans is that anytime there's a conversation about waste, fraud, and abuse, it's always about taking things away from those at the bottom end who need help the most. And look, one of our witnesses talked about how Medicaid is, as it is not necessarily a robust program. I would absolutely agree, but people depend on it. Lives depend on it. Hospitals, clinics, nursing homes depend on it. And the impact will not just be to the beneficiaries, the impact will be to those hospitals, to those clinics, to those nursing homes. Mr. Gordon, cuts like this, cuts like those in this really terrible, harmful bill will result in job loss. Would you agree? I mean, healthcare jobs are an important part of the economy, but healthcare jobs frequently are funded in part by programs like Medicaid.
I think that's right.
Yeah, thank you. And I know it's right. And that's why I have been visited by hospital CEOs, clinic CEOs, nursing home CEOs, who are all concerned about what this bill is going to do. At my town hall meetings, my constituents know full well what this bill is going to do. I would encourage all of our colleagues, host your town hall meetings, listen to your constituents, meet with your hospitals, meet with your clinics, meet with your nursing homes. There's still time to kill this awful bill, to work on a bipartisan bill that helps working people and makes millionaires and billionaires pay their fair share. Thanks, Mr. Chairman. I yield back.
I thank the gentlelady and now yield to my friend from Georgia, Mr. Andrew Clyde, for 5 minutes.
Thank you, Mr. Chairman, for holding this very important hearing. I hope the Senate gets the message. Despite fear-mongering from my Democrat colleagues, and I think there was a great example about hospitals being forced to close, tremendous fear-mongering, congressional Republicans are focused on rooting out waste, fraud, and abuse in programs like Medicaid and SNAP, ensuring they remain solvent for those who need them the most, which is the disabled, the elderly, pregnant women, and children. These programs should serve the truly vulnerable and not able-bodied adults who can work but don't or simply won't. Medicaid and SNAP make up over 10% of the federal budget, more than $700 billion annually, yet improper payments are rampant. Medicaid alone saw $31 billion in improper payments last year and over $500 billion over the past decade, enough to insure 6.3 million Americans, according to the Economic Policy Innovation Center. Additionally, Obamacare expanded Medicaid far beyond its original mission by covering able-bodied working-age adults. Worse, states are incentivized to prioritize this able-bodied group, receiving $9 in federal funds for every $1 that the states spend, while the truly vulnerable receive just a $1.33 match compared to what the state spends for a dollar that they spend. That's not just misguided. I think that's truly immoral between the two. The American people elected President Trump to restore trust in government and stop the runaway fraud and waste draining taxpayer dollars and threatening these safety net programs. I'm encouraged that House Republicans' One Big Beautiful Bill begins to address these issues by strengthening enrollment checks, discouraging the enrollment of illegal aliens, and instituting work requirements for able-bodied adults without dependents. However, the bill doesn't fix the broken match rate formula that prioritizes able-bodied over the most vulnerable, and I urge the Senate to address this huge disparity and return Medicaid to its original purpose, and that is protecting the most vulnerable. Dr. Blase, blue states like California now allow illegal aliens to access Medicaid. How does this expansion and the prioritization of illegal aliens over U.S. citizens crowd out access for core populations like the disabled, elderly, pregnant women, and children? And do you believe this has led to any preventable deaths among these groups?
Yeah, thanks for that question. You know, it really gets to the heart of what the incentives are that face states. And like you said, they have massive incentives to expand the program for able-bodied working-age adults. The scheme that California employed was this managed care tax where the state took the money from the managed care plans, spent it right back on the managed care plans. That was the money laundering mechanism. They then leveraged all this money from the federal government, and they expanded Medicaid to illegal immigrants the next year. So you could think they did it with, I mean, the money is fungible, so they really did it with all federal funds that came in for this expansion. There are significant problems with a crowd out in services. So we know in Medicaid expansion states, those states have taken resources away from children and away from people with disabilities. And if you're crowding, and there's been a surge in emergency room use for non-emergent needs. So that is all going to have negative adverse effects on the core Medicaid population.
Wow, well, thank you. Now, as noted, the federal match rate for Medicaid is up to 7 times higher for able-bodied adults than for the most vulnerable. If Congress fails to address this in the one big beautiful bill, do you expect that non-expansion states, like my state in Georgia, to eventually cave to the financial incentive? And does the CBO account for that possibility in its analysis when it talks about it?
So in part, it depends on whether the changes that the Senate is making are going to hold. They would lower the provider tax, ability of states to use provider taxes just in expansion states. That would serve as a disincentive for current non-expansion states to expand. But I do think there is a risk that non-expansion states, and I think non-expansion states made the right decision to maintain the program's focus on the most vulnerable, that they'll expand after the bill's passed.
And how much more do you think that would cost?
If all the non-expansion states expand, probably upwards of $300 billion
Is
over
that
a decade.
Over a decade? Wow. Thank you. So, Mr. Stehle, you spoke about a 10-year wait for in-home care for your son, or maybe it was 11. What other barriers do states impose that prevent the most vulnerable Medicaid recipients from accessing timely care?
Quick response, Mr. Stehle, please.
Oh, and my time is
That's okay.
expired, but please
Go ahead and
respond.
give the response, and I'll go to Ms. Jayapal.
So, sure, so ultimately, the biggest way that you see impediments to enrollment for these waivers is that it's just the waiting list. I mean, that is the main thing. But also, and I said this in my testimony, but I would just remind everyone that every dollar that isn't spent on the truly needy is a dollar that can't, that goes to able-bodied adults is a dollar that can't go to the truly needy.
Thank you very much.
I thank the gentleman and now yield to my friend, Ms. Jayapal from the great state of Washington.
Thank you so much, Mr. Chairman. You know, this hearing is a little bit like putting lipstick on a pig, and that's kind of disrespectful to the pig. But you can call this whatever you want, but at the end of the day, the big bad betrayal bill kicks 16 million Americans off of health care, and all so that you can deliver a giant tax break to the billionaires. And so I want to talk about this thing you're calling fraud in Medicaid. We all care about getting rid of waste, fraud, and abuse, but you don't fight fraud by punishing the poor. You fight fraud by going after the entities that commit fraud. And so, Mr. Gordon, in your experience, what's a bigger problem? Individuals fraudulently on Medicaid or private companies trying to extract improper payments from the government?
The scope of fraud by insurers and by providers vastly outstrips the scope of fraud by individuals, orders of magnitude. So we haven't talked about Medicare, fraud, abuse, whatever you want to call it, about $85 billion in 1 year, differential, upcoding, other practices in Medicare Advantage. In Medicaid, the vast majority of fraud, and this shows up in reports from DOJ, from the Inspector General, who, as people have pointed out, has historically been a nonpartisan official. She was there for 25 years until she was fired. Reports from those sources, very clear, it is fraud by providers,
That's right.
doctors, practices, et cetera.
That's right. So vast majority of fraud in Medicaid is by providers. So if you wanted to go after waste, fraud, and abuse in Medicaid, you would go after the providers and not the patients who need care. Does the Republican betrayal bill do anything to actually attack that place of the vast majority of fraud in Medicaid, provider fraud?
I'm not aware of that. I'll say there was a time when Congress invested more in program integrity initiatives by HHS and DOJ, and these are tough, and they save $4 for every dollar spent.
That's
And
right.
They go after the people, they go where the money is, not where the people in need are.
Those fraud units that, and the inspector generals that actually root out fraud that have been fired by this administration. In the big bad betrayal bill, what happens when people lose coverage? When those 16 million people lose coverage, what happens? Where do they go?
Well, they probably don't get preventive care because it's no
Right.
longer covered. And then if they get very sick, they probably go to the hospital and it becomes uncompensated care, which is often borne by taxpayers anyway.
Right, so they end up in emergency rooms at higher taxpayer cost, and that burdens hospitals as well, which is why they're trying to put a hospital fund into the Senate bill, because they're kicking people off of healthcare, but they realize that they're going to need to go somewhere to get care. So it sounds like kicking people off of Medicaid doesn't save money, it just shifts costs elsewhere, correct?
There certainly is a large cost shift, yes.
Okay, and do you think that this big bad betrayal bill, I want to make sure we call it that every time because big bad betrayal is what it is. Do you think it could lead to a more efficient administration of Medicaid, or is it just going to create more red tape and logistical issues and errors?
I don't think it will lead to more efficiency, no.
Now, I want to talk about work requirements quickly, because the nonpartisan Congressional Budget Office that estimated the 16 million people are going to lose their health care, a lot of those people are losing their health care due to the barriers from these newer and stricter so-called work requirements. I'm putting that in air quotes. Republicans are trying to say, hey, we're not denying people health care. We just want to have work requirements to make sure that they are working in order to get health care. So what percentage of people on Medicaid who are able to work are already working?
If you exclude people with disabilities, it's about 2/3.
The vast majority are already working. And I want to ask you about Arkansas. You mentioned it in your testimony because Arkansas proved that work requirements don't increase the number of people who work, they just increase the number of uninsured. So in 2018, Arkansas became the first state to implement work requirements for adults who were enrolled in Medicaid expansion. Did that lead to an increase in employment?
No,
And who was kicked off of Medicaid and why?
about 18,000 people, generally for procedural reasons because of bureaucratic issues.
And would you say that there are people who are able to live off of Medicaid alone? Like, is it desirable to avoid working so that you can be enrolled in Medicaid?
Nobody lives off Medicaid.
Nobody lives off Medicaid. So just to be clear, this is a big bad betrayal bill that strips Americans of 16 million Americans of health care, all to deliver tax breaks for the wealthiest. Thank you, Mr. Chairman. I yield back.
I thank the gentlelady and now yield 5 minutes to our colleague from North Carolina, Mr. McDowell.
Thank you, Mr. Chairman. Thank you for putting this hearing together today, and thank you all for being here. I am a preacher's kid, and every now and then, it was very rare, but every now and then I would see my dad go into the pulpit with a sermon, and he would feel led to say something else. And Mr. Stehle, what you shared with us today, the reason why you're here, having heard that, I felt compelled to completely abandon everything I was going to say. And I want to talk to you about work requirements, but first I want to say that we have a connection, because the reason I'm here is my little brother Luke, who passed away from a fentanyl poisoning. And I want to say that we haven't talked about it today, but I'd like to highlight that the parts of this bill that fund border security and give money to our law enforcement that prevent fentanyl from coming into our communities, I would have to push back on my colleague from Washington and say that's not a betrayal to families like mine. That's a very needed step. But so I know how hard it is to talk about our family in these settings. It's not easy. So I appreciate you being here and sharing your story. And Mr. Chairman, without objection, I'd like to enter into the record this article from the Wall Street Journal. My son is counting on Medicaid work requirements.
Without objection, so ordered.
So in North Carolina, which is where I'm from, there was a situation that I saw unfold with Medicaid, and it deals with something that happens to babies when they're born, but only to male babies, if you know what I'm talking about. And the Medicaid was billed as if those were sick babies, which is, I find fascinating because it's fraudulent, it's certainly abuse, and it's wasteful. That is the kind of problem that Medicaid has. And so I'm grateful to my colleagues for the fact that we're taking this seriously and trying to make this program work better for the people that need it. And that's what we're doing. And if that's a betrayal of the American people, I don't know up from down anymore. But in your op-ed, can you tell us why you felt compelled to be here today to share your story?
Sure. Yeah, absolutely. Thank you for that question. I'm here because expansion hurts the truly vulnerable in two really key ways. The first one is waiting lists, which we've talked a little bit about, and then also perverse incentives. So on that, I have three numbers that I want to share with you that I think are important. 85%, 700,000, and 36,000. 85% is the enrollment increase over the last 10 years directly attributable to able-bodied adults. 700,000 Americans on disability or with disabilities languish on waiting lists in this country. And then 36,000 in the dozen or so expansion states that responded to our FOIAs, more than 36,000 disabled individuals have died while waiting for their spot for those waivers since expansion began. So, and then just to sort of wrap that up, we've got 62% of people, of able-bodied adults who are on Medicaid who are not working. And that is a massive problem that's got to be dealt with.
Yeah, I mean, I think the best thing we can do is just say I wasn't in Congress, I didn't do anything else, I sat at home and played video games, I'm 31. I don't think I would need Medicaid, so that's probably a good call. Quickly with the more time, I don't have a lot of time left, so with the rest of the time, I want to say, everybody I talk to from either party that works in healthcare, if you ask them, what is the single most harmful piece of legislation that has ever happened to the healthcare industry, they say Obamacare, without fail. That is what they say. How have the Obamacare Medicaid expansions harmed the most vulnerable?
Yeah, so ultimately, it's what I just shared with you.
Yeah.
It's the waiting lists. And it also, by the way, it's also harmed able-bodied adults because they're not getting to experience that transformative power of work.
Yeah. Well, thank you, Mr. Chairman. My time's expired.
I thank the gentleman from North Carolina and now yield to our colleague from California, Ms. Judy Chu, for 5 minutes.
Mr. Gordon, Republicans are ripping off the American people under the guise that everyday Americans are defrauding Medicaid. We know that's not true because federal agencies report on Medicaid and Medicare fraud, and guess how many examples in last year's report listed of beneficiary fraud? It was 0. And who does the report show is committing fraud? Providers. Providers like Paul Walczak, a former nursing home executive who was sentenced to 18 months in prison and ordered to pay $4.4 million in restitution to nurses, doctors, and employees he had robbed for his own personal gain. What he done was withhold more than $10 million from the paycheck of these nurses and doctors and others under the pretext of using it for their Social Security, Medicare, and federal income taxes. Instead, he used some of the money to buy a $2 million yacht and to pay for travel and expenses at high-end retailers, including Bergdorf Goodman and Cartier. But Paul isn't serving his prison time, as you would think. Why not? Because Donald Trump pardoned him after his mother paid $1 million for a meet and greet at Mar-a-Lago. So, Mr. Gordon, why does this bill do nothing to stop the actual Medicaid fraud?
Thank you, Representative. I think the core issue is that provider fraud is where the money is. And to go after provider fraud, you invest in investigators, you invest in AI and mechanisms at the federal and state levels to examine payment claims, and you learn what's happening and you make it happen. And you need a strong inspector general, not one that's been turned upside down. And you need people at the Justice Department, which also has lost enormous numbers of people. That's where you're going to fight fraud.
Thank you. Mr. Gordon, when I think about the Americans that will be punished by the Republicans' proposed paperwork requirements for Medicaid, I think of people like my constituent Sandra from Rosemead, who lives paycheck to paycheck and relies on Medicaid to care for her child. Under the Republicans' proposal, people like Sandra who work full-time could still lose their Medicaid coverage she relies on if she forgets to submit the correct pay stub. We know this because the question of whether the Medicaid paperwork requirements that Republicans are proposing isn't hypothetical in terms of whether it'll work or not. There are multiple examples of states trying to implement this that were failures. And of course, you, Mr. Gordon, have eloquently talked about what happened when Michigan tried to implement these work requirements. You emphasize that the Republican proposal relies on myths, like the myth that millions of able-bodied Medicaid and SNAP benefits are doing nothing. Like you said, actually 2/3 are working, but these requirements will cause many to lose their coverage. And in fact, if we look at the case of Arkansas, many of them were low-wage workers, fast food workers, restaurant dishwashers and servers, construction workers, janitors, landscapers, motel cleaners, gas station clerks, and nursing assistants. Many had disabilities, and their ability to continue working depended on getting treatment to manage chronic pain, asthma, injuries, cancers, and mental health conditions. Some lost coverage simply because they couldn't navigate the policy's complicated requirements and labyrinth reporting processes. But others lost insurance because of the instability of low-wage work. Bosses cut their hours or laid them off without warning. There was limited public transit that narrowed their options, or they lived in struggling rural areas where jobs were hard to come by. And when the state cut them off, their health care worsened, and it was harder to get new jobs. And in fact, the Government Accountability Office studied this and found that, in fact, these cuts are extremely costly to the taxpayer and do nothing to boost employment and rip away, in fact, health care from hardworking Americans. So, Mr. Gordon, can you comment on how similar this is to Michigan?
Yeah, it is similar, and I actually want to point out one important difference. Arkansas, Georgia, and Michigan had it implemented, were implementing in periods of strong economy and low unemployment. This bill, the work requirements apply when unemployment is as high as 7.9%. People lose their jobs when unemployment is that high. Millions of people lose their jobs, and they take months to find jobs. And in this bill, in that period, they will lose their health care.
Thank you. I yield back.
I thank the gentlelady and now yield to Mr. Stutzman from the Hoosier State for 5 minutes.
Thank you, Mr. Chairman, and thank you to the panel for being here. This is a really important topic, and it's just interesting to hear the dialogue between the two sides. You know, I hear that there's no fraud from the other side, and my staff did a quick look to see if they could find cases of any sort of schemes or fraud of the healthcare program. So here's just a couple, and this is just a quick search. Money from $30 million Medicare scheme used to buy luxury cars, watches, federal prosecutors say. Ex-con charged with bilking $7.3 million from Medicaid in Minnesota. Lab operator convicted in a $4 million Medicare fraud scheme. 2 Connecticut residents charged with defrauding the state's Medicaid program out of $1.8 million. And this, I got numerous other lists. And so we, to say that there is no abuse of the programs, there's no fraud of the system, is just not intellectually honest. It is happening. And it will only continue to happen the more that the federal government doesn't do anything. And so, as we've heard today, You know, Obamacare was, the Affordable Care Act gives states mechanisms to rob the federal government through money laundering gimmicks. States like California use a number of ways to increase federal tax dollars going towards their budget. In fact, California's federal Medicaid reimbursements for 2025 will exceed the entire state budget for Florida. I mean, think about that. We're reimbursing one state, the largest state, California, just Medicaid reimbursements larger than the entire state of Florida's state budget. Over the past several years, we've seen California turn around and use those funds to provide care for illegal immigrants. And so, Mr. Stehle, I'd like to come to you because, and first of all, thank you for coming. You're the private citizen that we all think about when we're talking about these issues on both sides, I believe. But you're here saying, I mean, you've heard both sides. You know, we're saying, look, we've got to stop the fraud and the abuse. We've got to make changes to help your family. I know other people exactly like you. They call me and they're like, I'm doing everything I can to help get my child who has special needs onto Medicaid. What am I doing wrong? You know, nobody on this dais, I'll just about guarantee you, uses Medicaid on this dais. You have personal experience. So you're hearing both sides, and I don't want to put you in an awkward spot, but are you afraid now that you're not going to have any access? Because you're not even on, correct?
Right, so he's actually on what's called a TEFRA waiver for Medicaid, but he isn't getting the community-based services right now. Yeah, I think the thing that comes to mind the most for me is I keep hearing so much about Arkansas. I'm from Arkansas. I know a bit about the state. And there was this supposed study that was done that said that everything that we're doing isn't gonna help. And basically it relied on this self-reported information about the previous year, not real wage data. It surveyed people who weren't even subject to the work requirement, including people who were already working, people who had young kids at home. It did not exclude some other people who were exempt, like for education or substance abuse programs. And it was conducted before the work requirement ever even was fully in place. And so, but what we did is we actually got agency data and records from Arkansas's DHS, and we know that tens of thousands of people were able to find employment and see their wages rise, and as well as the fact that 87% of people who ultimately left the program were for higher incomes, or because they moved out of state, or because they were never eligible to begin with. Only 13% for noncompliance. And so when I hear of the conversation, the back and forth, that's what I think about, because I saw it work, and I saw that our taxpayers were on track to save $300 million in year one.
Wow. Well, I wasn't here earlier, but I'm guessing this is your family here?
They are.
Thank you for coming, because you're the people. I mean, we have constituents. I have a family. You know, I have cousins, I have uncles, aunts, and they're dealing with challenges with healthcare right now. And we were all promised that Obamacare was going to fix the problems. And I believe this is that, you know, we have people across this country, and let's just take church people, for example, that are sitting there. They're either depending on Medicaid or they're using Medi-Share programs. There's not good options. There's too many hands in the cookie jar. The cost of healthcare is out of control. We need to do something. So thank you to you and your family for coming and sitting through this long committee hearing.
Thank you.
I thank the gentleman from Indiana, and now yield 5 minutes to our colleague, Ms. Capter from the state of Ohio.
Thank you, Chair Arrington, very much, and to our guests today, our witnesses, we appreciate your coming. I want to start with a big frame. In the district I represent, 216,500 people rely on Medicaid for their health coverage. Any national proposal that would axe billions of dollars in Medicaid coverage, I consider dangerous and inhumane. And the burden will be felt by individuals who, many of whom have medical conditions, and I really consider it cruel. The bill that this health area is a part of is a big billionaire bill that proposes to cut, get ready for this, $863 billion from Medicaid and cuts $372 billion from the Affordable Care Act. Those total $1.1 trillion in healthcare cuts over 10 years. But there's no savings to the U.S. debt because the same big billionaire bill then adds $3.4 trillion to the U.S. debt by bestowing $340,000 per billionaire in tax breaks each year. And those cuts are permanent. So in the end, if you subtract, despite we're asking people who are ill or who don't have health insurance to make a sacrifice for the republic, the billionaires make so much more, they add $2.3 trillion to the U.S. debt. So this bill doesn't save money. It puts us deeper in debt, and it's harsher on the people who have more challenges. Now, I represent 8 counties in Northwest Ohio, 7 largely rural. A half dozen hospitals serve those counties, but half the hospital's income or more comes from Medicaid and Medicare. And like my dear colleague from Kentucky, what is happening is so dangerous because due to razor-thin operating margins, often at 1.5% right now, cuts in Medicaid and Medicare will cause them to close. This is an alarm bell across rural America. We already had a closure of Hicksville Hospital in Defiance County. Meanwhile, our region has the highest child mortality rate in our state. This is going to make the billionaire bill is going to make it harder for ordinary people to make it. And they don't have a loud megaphone like this one, or each of us here. So I had a couple questions for Dr. Blase. Dr. Blase, last year, a rural clinic I represent, where many families rely on Medicaid, was forced to halt prenatal care after its OBGYN contract lapsed due to, guess what, financial strain. And as I said, I represent the region of Ohio with the largest child death rate, child mortality, because we don't have enough prenatal care and care for mothers and pregnant women. So this particular situation forced one mother to drive over 40 minutes for routine checkups while juggling 2 jobs with child care problems. If Medicaid payments drop further, more clinics will follow suit. So who exactly do you expect to absorb the cost of that lost access, of delayed diagnoses, of ER visits for preventable conditions, and worsening maternal health outcomes in communities like hers? In your policy analysis, do you account for the economic and human impact of hospitals closing maternity wards, mental health units, or rural clinics due to reduced Medicaid reimbursements? And second question, a 72-year-old grandmother was dropped from Medicaid because she missed a notice while recovering from hip surgery. She ended up in the ER, which we know is expensive, when she couldn't afford her follow-on care. How does forcing someone like her off Medicaid improve our healthcare system? Wouldn't enforcement be better focused on high-dollar fraud? Some of my Republican colleagues agree on this. I certainly do, like tax evasion by billionaires. How about that? The IRS is 20,000 auditors short. They're not being allowed to hire them to go after the billionaires that could help pay these bills. So those are my 2 questions.
Thank you, Congresswoman. So I can't talk about the specifics of those 2 cases. I certainly think it's true that rural hospitals play a unique role. They face unique challenges. I would say that there has been a flood of money that has come into the healthcare system through improper payments, through growth in Medicaid, through growth in Obamacare over the last couple of years. And the problem is a lot of this money doesn't get to where it's most needed. It is going to health insurance companies. A large part of the agenda has been to increase subsidies to health insurance companies on behalf of some people that don't even know they're covered and that don't use any services. So I think what we need to do is fundamentally redesign the incentives underlying all of these government subsidies, because I think we could take care of the challenges that you mentioned and significantly reduce a lot of this wasteful spending.
I don't think that this bill does it. And if I look at the number of ads on TV when I get home, I don't know if Chairman Arrington finds this or not, but the 2 initials are MA. And those 2 initials cost the people that I represent huge amounts of money, and then they think it's a better plan than Medicare, and then they find out, oh, I'm not eligible for that treatment. So there's a lot of cleanup that has to be done, and I just think a meat axe to these programs is not the way to approach care.
And we
need
think
a
there's
careful
opportunities to
approach
reform Medicare Advantage as well. Paragon put out a paper last year on Medicare Advantage reform, so we would welcome working on Medicare Advantage reform.
And the gentlelady's time's expired, but I will chime in to say, I agree that we need, there is work to do to reform Medicare Advantage, and we'll probably have a hearing at some point on that. And I'm one of the Republicans that believes that. I think there are several budget hawks who feel like there are not just reforms for the sake of a better system for our seniors, but there are savings for taxpayers and this massive and growing deficit problem that we all know we have. So thank you for making mention of that. Bringing us home on the Republican side, the great Blake Moore from the state of Utah. 5 minutes.
I am from Utah. That's true in your response there. I assume I'll get an extra couple minutes, as I'm sure you're allowing for many others, Chairman. Chairman, actually, a couple quick questions to you first. I just can't let it continue on. It deserves a response. You and I worked on the tax portion of the reconciliation bill, the one big beautiful bill. You and I worked for a year plus on that. A couple quick things. Is the standard would you say the standard deduction and the child tax credit are two of the largest tax provisions in the entirety of the bill?
I think it's 90+% of the American people use the standard deduction.
So of the bill that we did, there's always a cost and a scoring to all of this. The standard deduction and the child tax credit are two of the largest. Do you believe that to be true?
That's true, and if the TCJA expired and we did nothing, they would be cut in half both.
Do the wealthiest of our nation take advantage of the standard deduction, the doubling of the standard deduction that we did? Or do they itemize usually?
They itemize, and the top 1% of the wealthiest of Americans actually paid a higher share of taxes after TCJA.
Is the child tax credit, the doubling of the child tax credit almost, and the enhancement that we added to our bill of the child tax credit, is that capped at an income level, at a certain income level?
Yes.
So if you make more money than the income level, which they're claiming, the billionaires and the wealthy, they can't take advantage of the majority of the tax provisions that we did.
That's correct, and the top 10% after TCJA went from 70% of paying all of the federal expenses for our nation to paying 75% of all the expenses of our nation.
And thank you. I'd just like to clarify things with data and actual accuracy about what our tax provisions actually are. You can say what you want, but it's just not, it's not reflected in the actual policy. The American Rescue Plan, last question, do you agree with Democrat administration, two previous Democrat administration advisor, Larry Summers, when he said that the American Rescue Plan is a significant reason for the massive inflation that we saw over the last few years?
I think the words of Larry Summers was something to the effect of the monies in the American Rescue Plan, the stimulus monies, the trillions of dollars would be like a bathtub overflowing in a house, and we would flood the marketplace with federal stimulus that would create the historic inflation that we actually experienced. So he was right.
Republican tax provisions from 2017 and what we're making permanent and repeating here in this bill empower the American workforce. They grow the economy. They raise real wages. When Democrats had an opportunity to do reconciliation in 2021, they created the American Rescue Plan, which takes away immediate discretionary income from the lowest income earners. Inflation is a tax on lower income earners. Right? It's a clear distinction. I hope we can cut through the nonsense of constantly what we see, but when you empower the American workforce, that's what you have. Chairman, I ask unanimous consent to submit into the record a recently released paper from the Paragon Health Institute titled "The Greater Obamacare Enrollment Fraud, the Fraud That Got Much Worse in 2025." This paper describes the surge of nearly 6.4 million fraudulent and improper enrollments within the Obamacare exchanges due to the lax CMS enforcement and Biden's misguided COVID-era policies.
That objection so ordered.
Thank you. Dr. Blase, you recently published this report, The Greater Obamacare Enrollment Fraud. Can you please provide for us a short summary of your findings?
Yeah, so it starts with what you mentioned, the American Rescue Plan Act, because it massively increased Obamacare subsidies. So it made coverage free for people that claim income between 100 and 150% of the poverty line. The Biden administration then stopped checking income eligibility. And if people got too much subsidy, because the subsidy is based on estimated income, they didn't have to pay back the full amount of subsidy. So it created a recipe for fraud. And what we saw happen is that fraudsters and bad actors took advantage of this. So they advertised free cash, they advertised gift cards, they manipulated people, they got individuals to call, people were looking for their cash, they didn't get cash, they got enrolled in a health insurance plan instead. Many times they already had other coverage or they weren't looking to get enrolled in coverage. And that scheme overall just grew to be a massive effort because the incentives were so bad and so misaligned to create massive fraud. So in 15 states, we estimate that there's twice as many people enrolled than is eligible. So one thing that the One Big Beautiful Bill is going to do is to actually check eligibility of people before they enroll in this coverage. And the main beneficiaries are fraudulent brokers who really had evil intentions just to rip off the vulnerable and taxpayers, and health insurance companies. This big thing about people losing their coverage, a lot of it is just massive subsidies that health insurance companies have received for people that don't know that they have coverage.
Thank you. You covered most of the other things I was going to ask. I just want to re-highlight. Consumers unknowingly were impacted by bad actors and agents and brokers, either by having their coverage switched without their consent or facing tax penalties for the advanced premium tax credit that they unknowingly received.
Yeah, so some of these individuals are going to be on the hook for thousands of dollars of recoupments because they were enrolled in a plan that they didn't plan on signing up for. But the Biden administration just made it so easy for these bad actor brokers to sign them up and rip off the federal government and harm the enrollee.
Thank you, and I yield back.
Thank the gentleman, and yield now 5 minutes to my friend from Minnesota, Ms. Ilhan Omar.
Thank you so much, Chairman. I want to start by addressing the false narrative that always underpins this whole debate, which is the idea that millions of Americans are just sitting around refusing to work unless we threaten to take away their health care or food. I can't believe I have to say this, but people want to work. They work to support themselves, their families, to find purpose in life, and to be active in their communities. We should be making it easier for people to find better work, to care for their children, their loved ones, and to access the benefits they deserve. This is why Democrats have offered real solutions to support working people, from expanding childcare to modernizing our unemployment insurance system to investing in job training and raising wages. These policies are rooted in the belief that all of our constituents want to and can succeed, and that government should serve as a partner, not as an obstacle, in helping people build stable and dignified lives. Mr. Gordon, I want to give you the space to say it plainly. Is there any credible evidence that adding more work requirements will increase employment? And if not, where do these so-called cost savings really come from?
The experience in Arkansas was that employment did not go up. That's not based on private records that someone might have gathered. That is based on employment levels, publicly measured, publicly available. The experience with SNAP work requirements, multiple studies on this, peer-reviewed, don't increase work levels. We've talked about, there was discussion of welfare reform 30 years ago. Welfare reform included resources for the kinds of things you were talking about, childcare, transportation, job training. This bill has none of that. They're all being cut right now. States will have more constrained resources because of this bill. They will have to make cuts in those kinds of programs as well. Very different circumstance. So I think the losses you will see in this bill, particularly in periods of high unemployment, 7.9% unemployment, you will still have Medicaid work requirements. 9.9% unemployment, you will still have SNAP work requirements. So you have periods when people who have been working people their whole lives lose their jobs, can't get enough hours, lose their health care, lose benefits.
Thank you, Mr. Gordon. I know that you have also worked extensively in improving government operations and making service delivery more efficient and effective. Can you speak to how work requirements and eligibility recertifications like those proposed in this reconciliation bill can actually affect administrative inefficiency?
Yeah, so you have a continual push here to make people recertify again and again and again and provide the same information over and over and over. So I worked in the last administration on simplification. One of the ideas was if the government has information, we should use that instead of asking people to provide all of it and verify all of it again. That principle is embodied in a rule that the House legislation suspends. It says no more of that, we don't want that. Another principle is if you can't find someone and you have a very important piece of information to give them, like you're about to take away their health care, maybe you should try one more time. Find a different way. You sent a letter, maybe try to send them a text or a call. The rule that's suspended embodied that principle, that we should try to treat people with respect, recognize these are important things to them, and just try to do the right thing, and that rule is suspended.
It sounds like you're also suggesting that the added paperwork requirements, but these proposals increase government spending and bureaucratic complexity. Could you provide state-level example or research?
Yeah, so when I was in Michigan, we spent $30 million in a little bit more than a year on preparing for in the very early stages of Medicaid work requirements implementation. And Michigan actually had good data systems that predated me or anyone there. They were prepared to link up data. You'll have a lot of states that aren't prepared to do that, that will have to spend more and more or put more and more burdens on people, and it will be a very costly undertaking.
I appreciate that. I know that my time is coming to close. I want to ask one last question, Mr. Chairman, if that's okay. On the federal side, under the Biden administration, the OIRA led important work to reduce administrative burden, streamlining how people access public goods. Mr. Gordon, could you briefly discuss this initiative in a more detail and how it could improve access and delivery of public service?
Yeah, there was an effort to reduce burdens, better handoffs, use more information the government already has, simpler forms. And by the way, all of that coexisted with wanting to invest more in fighting actual waste, fraud, and abuse. You can do the two things at once. And that's what the administration was trying to do.
I appreciate that. I yield back.
Thank you to the gentleman from Minnesota. Chair now recognizes the gentleman from Wisconsin, Mr. Grothman.
Okay, here we are. Just a general question right off the top. I noticed that SNAP benefits have gone up from $60 billion in 2019 to $113 billion in 2023. So in just 4 years, we had this massive increase at a time where I bet, we were post-COVID, people were back to work. What happened? What can we attribute this massive increase in payments to?
It was a unilateral increase in the benefit level by President Biden through administrative action with no authority from Congress. President Biden's administration in 2021 reevaluated the Thrifty Food Plan, which is an input to the formula, and increased it by 21% overnight, over and above inflation, above the annual COLA, and spending has exploded.
I can see that being one of the reasons, and 20% is a pretty hefty number in one shot. It looks like overall the spending increased by about over 80%. Was there anything else as well? Were people just becoming more comfortable with getting on food stamps, or the stigma was gone, or what's the deal?
Yeah, enrollment did expand somewhat, but the primary increase in the increase in spending is that people are getting higher levels of benefits and staying on the program longer.
Okay, well, ask some of you guys, because I keep hearing, because I bring this topic up back home, and everybody's got anecdotal evidence of young people not getting married because they get benefits. And here we're talking about Medicaid, we're talking about SNAP, but it could apply to other benefits as well. Is there any data on how many people are raising their children with a single parent rather than two parents because they want to get these benefits? And I hear common when I get home, common, my niece, my next door neighbor's daughter, whatever. I hear all the time, young couples not getting married because of these programs. So when do you guys want to comment on that?
I mean, I don't know the specific data points, but there are significant marriage penalties in the loss of benefits and in the way the tax code is structured. And I don't think the tax code and these benefit programs should discourage
I'm not saying the
marriage.
tax code. I think the programs themselves, the tax code's no gem, but I think, you know, I hear of people, or, well, first of all, talk about the marriage son. You can elaborate on that. The number of people who you believe are not getting married or choosing to raise their child.
Yeah, I mean, there's significant disincentives, and it occurs with the Obamacare premium tax credits and the way they phase out. I mean, there's significant marriage penalties built into a lot of these government programs.
Okay, I don't know whether the people who put together these programs feel guilty about this or not. I really don't know. Next question. I also know of people who are working for cash, because if they work for cash, they can get these benefits as well. I don't know how we identify that, because of course it's not in the government system. People lie about working for cash. But is this a big problem? How many people do you think are working for cash in home care or whatever, construction, because it's a way to get your benefits as well? This is I think it's a common problem, but just what do you want to say?
I mean, the GAO identifies income and eligibility and identity verification as the biggest source of waste, fraud, and abuse and improper payments.
Okay, hopefully that's something we're going to. The other thing I hear all the time from employers, particularly if people are relatively low income otherwise, is that people stop working at a given number because they want the Medicaid, which is understandable. Healthcare is very expensive. But do we have an idea how many hours people are not working because we bribe them to get with the benefits?
Yeah, I mean, it is a huge disincentive to work, the massive welfare benefit. The CBO just released a report about the size and scope of the welfare state. We spend more than $1.2 trillion every single year just on a handful of welfare programs, and people are eligible to pull down tens of thousands of dollars in benefits, so as long as they're not increasing their income. And it does create a big disincentive to re-enter to the workforce.
You ask people and they all have examples. My sister, my niece, da-da-da-da-da. Robert?
Thanks.
Do you run into this in your profession, or are you kind of isolated from it? I mean, do you see all these people who are working less than they have to keep their benefits coming?
Benefits have an incentive effect. I think, sir, it is less than you are saying, and I think there's huge consequences to the kinds of changes that are in this bill.
Okay, do you think the bill's going to make things better, make people a little more honest, or are we going to continue down the path of saying, don't work and make another $1,000, or you lose your medical benefits, you lose your SNAPs, whatever?
I think actually the system we have has done a lot to eliminate the kinds of problems you're describing. And of course, we should be sensitive to these issues. But I think what will happen here is people are just going to lose their health care, and that's going to make it harder for them to work, sir, at least in my view.
Okay, well, thank you. I just tell you what the average guy back home is telling me.
Thank you to the gentleman from Wisconsin. Now, Chair recognizes the gentleman from Rhode Island, Mr. Amo.
Thank you, Mr. Chairman, and thank you to our witnesses for being here. You know, I've long heard the line from my colleagues that Republicans are supposed to be the party of small government and cutting red tape. You know, at least that's what President Trump claimed he'd do in 2017 when he promised very boldly that he was coming to government to cut the red tape. And so, you know, why is it that I hear Republicans say that they don't want to cut red tape but are pressing on with the bill, this big bill of some questionable description that adds red tape. I know that Republicans repeatedly spoke in defense of burying vulnerable Americans under a mountain of red tape. That's a fear, a long concern of my colleagues. They defended making it harder for millions to get health insurance and nutrition assistance. Frankly, I think it's my hope that Republicans work to mean what they say and actually cut red tape. Because if they wanted to cut red tape, Republicans would not add these onerous requirements that will kick 4.8 million people off Medicaid. If they wanted to eliminate waste, Republicans would not push a plan that adds red tape to rip away SNAP from approximately 3.2 million Americans each month. If they wanted to stop fraud and abuse, Republicans would not defund our tax police by slashing $2.4 billion from the IRS budget to make it easier for wealthy tax cheats to get away with their crimes. If they wanted to balance the budget, Republicans would not be passing the greatest wealth transfer in our nation's history that adds over $2.8 trillion to the deficit. So the answer for me to those questions is just that I'm not quite sure that my Republican colleagues mean what they say. I truly feel that this is a reverse Robin Hood scheme when we look at this big bill, to take away from the poor to give to the rich. You know, this bill and this big bad bill for billionaires would put an extra $12,000 in the pocket of the ultra-rich every year while taking $1,600 a year out of vulnerable families' already tight budgets. We share that concern. We care for these families. This is not the way to help them. Republicans' claims about Medicaid are, frankly, questionable at best and disingenuous at worst. We know that in 2023, 92% of adults under the age of 65 with Medicaid were working, caring for family, ill, disabled, or in school. And we know that adding additional red tape to Medicaid isn't just expensive, it's incredibly difficult for enrollees to navigate. It doesn't increase employment and will cause everyday people to be sicker. So, Mr. Gordon, my question is for you, given your experience as director of Michigan's Department of Health and Human Services. When the state added red tape to Medicaid in 2019, it cost $30 million to implement, is that right?
Or had the program not been enjoined?
And in that experience, was it easy for enrollees to navigate additional red tape?
I think we were committed to doing all we could to limit the red tape, and I think if this bill passes, states will do all that they can, and it will still be very, very difficult. And you saw that in what was tracking to happen in Michigan, which is more than 100,000 people were on track to lose their health care.
Did it save any money?
I actually don't remember what the budgeting was. It certainly in the long term would have made for a less prosperous state that had less tax revenue in the long term, because healthcare enables people to work and enables families to be stronger.
And when it was the case the red tape kicked off eligible people from Medicaid, was there a corresponding increase in employment? And if there wasn't, why do you think that was the case?
We didn't get to that point in Michigan because of the injunction, but the best data on the effect of work requirements is out of Arkansas, no effect on employment. There's also very recent data on the effect of work requirements in SNAP, no effect on employment.
So the fact of the matter is, people who do and have possess the capacity to work generally do work, and making it harder for them to get health care and all these other populations who might be inhibited for some reason doesn't do anything to make things less expensive for us in running our governments. We ultimately have to pay for their health care in some way, and ultimately it makes our communities weaker. And so this big bill has this net effect of being bad for the average American, and it's important that we realize that the red tape is a pathway to causing more harm. With that, I yield back my time.
Thank you to the gentleman from Rhode Island. I've been to Bristol, Rhode Island before. I think you guys have an upcoming 4th of July parade, right?
The oldest 4th of July parade.
Oldest 4th of July parade?
You're welcome to come at any point.
It's a bucket list. I wasn't there during that time, but I was at Roger Williams University for a couple days of a work project. And A really, really neat town, so thank you.
Thank you.
Thank you to each of our witnesses for your testimony. Honestly, you bring an enormous amount of experience, expertise, research in all of these discussions, and I could go down the list and talk about some of the things that you've highlighted today. And there's merit here, and there's an opportunity, I believe, to be able to, with regards to work requirements, Mr. Gordon, I've just met with a whole bunch of folks back home, advocacy groups on Medicaid, like the hospitals. We've got to do this right, and we need to be cognizant of the potential of individuals that are getting through the administrative piece of this to show that they're willing to work a few hours a week or do a volunteerism. The exemptions need to be highlighted significantly, though. The Republican side here is taking great care of making this very doable, but to enact a policy that the majority of Americans absolutely agree with, and that we've seen Democrat administrations embrace before. And the potential cost for someone that chooses not to adhere to those eligibility guidelines, like, there could be a cost on hospitals. Like, we get that. We get all that. It's important. I appreciate you bringing up that concept, and we've got to work through this together. We have the timeline that we've set forth. We've got 18 months to get people in a good spot so they can be working. It's a minimal amount of work or volunteerism, but it shows that they're willing to contribute to their community to be able to get this benefit as well. There's a lot to be gained from this potential. And Dr. Blase, thank you for bringing, again, the research and what we talked about, your Medicaid expertise and your family here. I didn't get a chance to ask you a question, Mr. Dickerson. I actually had one. My the LDS Church runs a welfare program that is second to none. It trumps anything, it just smokes out anything that we can do here federally. We talk about and self-reliance and making it possible for people to get back on their feet. We truly, run it. It's near and dear to members of my faith, and we're getting a little bit closer to being able to do that with what we're trying to do through this bill. So thank you for being here today. What we've learned today is another wake-up call. Our safety net is operating under immense strain, the result of decades of inadequate oversight, misplaced priorities, and a bipartisan failure to prioritize the dignity of work over political pandering that is sentencing individuals and families to generations of poverty and dependence. It's time to make overall widely accepted policy change. It's implemented the right way. That's what we're trying to do with this reconciliation bill. It's a meaningful first step to help preserve and strengthen the nation's entitlement programs for the American people that we're designed to serve. We're not cutting benefits, we're protecting those resources to survive. This is not a partisan wish list, it's about restoring basic principles in fairness, morality, stewardship, and good governance. So I hope we can move forward, not without fear-mongering, but with clarity and conviction. Let's protect our vital safety net programs from exploitation and preserve them for the next generation. I'm proud of the work that we've done to craft serious solutions, and now it is time to act. So again, thank you, Dr. Blase, Mr. Stehle, Mr. Dickerson, and Mr. Gordon for appearing before us today. Please be advised that members may submit written questions and be answered later in writing. Those questions and your answers will be made part of the formal hearing record. Any members who wish to submit questions for the record may do so within 7 days. And with that, the committee stands adjourned.